For those that we are meeting for the first time, my name is Gladys Gashanja. I am a journalist, but for this two-day conference, I'll be your moderator and, of course, Master of Ceremonies. And remember, this is the inaugural National Policy Conference on Early Childhood Care, Education and Development. It is a big deal that we are in this room on behalf of our children and to enrich the ECCED in this conference or in this country. And remember, the theme of this conference is advancing Kenya's ECCED legal reforms in the era of devolution. And we are here definitely courtesy of our hosts who are the Collaborative Action for Childcare Initiative. Thank you so much for making time and being here on behalf of our children from wherever you are from in this country. Again, we say thank you. So if you're seated next to somebody you have not met this afternoon, tafadhali msalimie. Just say hi, look at each other, smile at each other, be familiar. We are Africans, we cannot sit next to each other na tujuani. Chungulia mask kidogo angalau msipitane. Excellent. I love the smiles that are being passed around. Asanteni sana. Okay, so in this session, we shall have a plenary session that has 3 speakers. It will go by pretty fast. And after that, we shall move on to the second session of breakout panels. In the first session, a lot of conversations have been heard, and I could see a lot of engagement and passion even as you spoke about the different areas that were accorded to the different breakout sessions. So this will happen again the second time round, definitely chaired by different people, and I will be announcing that in a moment. Remember, if you are tweeting from whatever Twitter account that is an affiliate of this conference, tafadhali use that hashtag, which I believe should be put up on our screens, and that is hashtag ECCED Policy Conference, that is CONF 2022, so that we can keep the conversation going and also let those who are not here understand what exactly they're missing out on and what role they can play in it. Remember, this is also a hybrid event, and there are those who are joining us virtually, so it is also important to keep that conversation virtually going on to ensure that we have the information spreading far and wide. Now, I would like at this point to actually acknowledge people amongst us who perhaps might not feature in our program, but they are very vital on this journey we are undertaking to enrich our ECCED in this country. And I'll start off with the Department of Children's Services, aptly represented by the Deputy Director, that is Mr. Mwambi Mongare. If you can wave to us wherever you are. Thank you for your time. Tafadhali, let's appreciate him. We're also joined by the CEO, National Council on Children Policy Matters, that is Mr. Mohammed. Uko wapi? Mr. Mohammed, can we see you? Can you wave at us? Can somebody see him anywhere? As soon as he walks into the room, tafadhali, let me know so that we can acknowledge him. And the Deputy Commissioner General, Kenya Prison Services, Madam Florence Omundi, who is here with us. Tafadhali, wave and appreciate her. Thank you for your time. You are a great partner, even as we continue on this agenda of enriching ECCED in this country. Now, to kickstart this second session, as I mentioned, we have 3 speakers, to be specific. We'll start off with somebody from the Early Childhood Development Network for Kenya, and this is Lily Oyare, who is a board member of the Early Childhood Development Network for Kenya. She is going to be presenting on behalf of Dr. Teresa Moma. Now, she will be speaking on the importance of state and non-state partnership and coordination for early childhood development. I think at this point we cannot ignore, and I think this has been said over and over again during our conversations in the day, that it is so important that partnerships are actually harnessed to ensure that we are able to move further for our children. And in this case, we shall be hearing from her first off. So tafadhali, Lily Oyare, if you can make your way to the podium. Please, let's appreciate Hannah Makofi. She is a board member at the Early Childhood Development Network for Kenya. At this point, let me just reiterate, we have a very short time to be able to do these presentations. So for all our speakers, including Lily, please let's take the 10 minutes that's been given to us so that we're able to cover as much as we can. And yes, we'll have a few minutes of question and answer for those who've said they feel like they're missing out on some breakout rooms that they would love to be part of, and seeing that we're touching on some of those matters that will be discussed further. Perhaps we can give you a few minutes before we break off into the other breakout rooms. Karibu.
Thank you. Good afternoon, ladies and gentlemen. Good afternoon, ladies and gentlemen. As you've heard, my name is Lily Oyari. I am standing here at capacity of ECCED Network for Kenya, Board of Director. And I'm representing Dr. Teresa Mwoma. I'm here to speak about collaboration and partnership in early childhood development. So I will start. Early childhood is complex and multifaceted in nature, requiring a range of sectors to collaborate to support children's development. Cayley in 1996 observed that for collaboration to be successful, there must be both organizational and individual support. Organizational support requires leadership that affirms and encourages partnership and collaborative opportunities. Partnership in education builds bridges between families, communities, and schools. As children interact with the people, places, and things associated with the family, the immediate community, and beyond, they extend their horizons to develop the attitudes, skills, and knowledge they need to become effective citizens. ECCED Net for Kenya, a membership of non-profit organization. The secretariat is hosted at Kenyatta University. It was established in 2015 September to bridge the coordination gap of ECD initiatives in Kenya. It was launched in October 2016 during our first national ECD conference, which was held at KICD. It was registered in September 2019. ECD NEC works closely with national and county government through the Ministry of Education, Ministry of Health, and Council of Governors. Members of NECEC in charge of implementation of pre-primary education. We are also members of National Steering Committee for Curriculum Reforms. So we were instrumental when the curriculum was being formed in 2016 to 2019. We are also members of Nurturing Care Technical Working Group. What's our vision? Our vision is strong multi-sectoral collaboration advancing nurturing care for early childhood development in Kenya. What is our mission? We promote, support, and sustain an enabling environment for the implementation of nurturing care for early childhood development through research, advocacy, effective partnership like what we are doing today, and coordination. We have all those different partners, if you can check on the screen. So if you're here and you've not joined, please, we have the staff around here from the Secretariat, Judy, Rachel, at the back, they can register you. ECD NEC, collaboration and partnership. ECD NEC has formed strong collaboration with other organizations, donors, partners through the below avenues. Convening and coordination of ECD Stakeholders Conference. We held our 4th conference last year in 2021 in Siaya, and we have First Lady from Siaya around with us, and thank you very much for hosting us. Working in collaboration with county government, Ministry of Education, Ministry of Health, and Council of Governors. Formation of county chapters in championing of ECD initiative. Concur with County First Ladies Association initiatives on implementation of nurturing care. And thank you very much for the different First Ladies who are here with us. Thank you very much. Can we applaud them for taking time to come and being here with us? Forming partnership with other organizations through co-implementation of projects. Sensitization of media on ECD, social media, and mainstream media. Collaboration and partnership with ECD actors. As you've heard me say, we held our 4th ECD Stakeholders Conference. It was held in Siaya, and we painted Siaya red in October last year. The theme was responsive caregiving for children in diverse circumstances, innovation, and inclusivity. The national conferences promotes networking, sharing, and learning platforms for all ECD actors. We had a total of 541 delegates, 275 physically present, and 266 were via through Zoom. From 23 counties in Kenya, we had 10 countries and over 70 organizations comprising government officials, United Nations agencies, civil society, philanthropists, donors, and academia. The 3rd ECD Stakeholders Conference was held in Mombasa, and the theme was promoting synergies, inclusive approaches to ECD. Inclusive means making sure in our ECD programs we have children with disabilities. We remember children who are in prison because all of them are children. And over 270 delegates were able to be present from 30 counties, comprising government officials, United Nations agencies, civil society, and philanthropists, donors, and academia. The 2nd ECD Stakeholders Conference was held in Kenyatta University, and the theme was accelerating early childhood development through collaboration and partnership. That year, we were able to reach 150 delegates from 26 counties, 50 organizations comprising government officials, United Nations agencies, civil society, philanthropists, donors, and academia. Formation of county chapters, that is where we are at, and we are being supported by AFCEN. We have Makueni County, you can see from the picture. The primary goal of collaboration between states and non-state actors in formation of county chapters were to enhance positive outcomes through provision of quality early childhood development services to children, to all children. Build an interdependent system to address and champion issues and opportunities around childcare, and to promote sharing of resources and responsibilities to jointly plan, implement, and evaluate programs in order to achieve common goals. Strengthening of collaboration through county chapters. We have the picture there of the meeting which was held in Mombasa. We have also a picture there of Kajiado, Nairobi, and Kiambu. So those are the counties where we have reached so far. Launch of ECD NEC 2021-2025, a strategic plan which happened in Siaya last year when we were having our 4th stakeholders conference, and it is championing ECD stroke nurturing care. The First Lady is supporting the launch of ECD NEC strategy plan during the 4th ECD stakeholders conference. The strategic plan envisions strengthening of multi-sectoral collaboration on advancing nurturing care for early childhood development in Kenya. You can see there the First Lady, Kiambu County, promoting nurturing care by supporting health facilities for Kiambu on promotion of good nutrition through sensitization of mothers on kitchen gardening. Because when we have children who are well taken care of, then they will be able to excel academically, socially, and spiritually. Partnership with county governments. Nairobi County, you can see there, Dr. Teresa giving out the PPEs when schools reopened. And that was an initiative which was done through the ECD NEC. Then co-implementation of projects with partner. ECD NEC co-implemented ECD-related intervention with Uthabiti Africa on collaborative action on childcare, and this was done in Nairobi County and Mombasa County, Kisumu County, and Malezi Bora ya Awali with Kanko and Comic Relief. Advocacy through media on early childhood development. I know most of us have seen Dr. Teresa on different media championing ECD, early childhood development and nurturing care. You can see her there on the Good Morning show and the KCB show. We also have their KTN. Then going forward, we roll out county chapters to reach grassroots levels in 47 counties. So that is our mandate, to make sure we reach all our children. Increase membership base. If you're here and you're not a member of ECD NEC, please, as I've requested earlier, our officers are at the back. You can register yourself and be part of this movement, which is championing the rights of children in early childhood education and nurturing care. Collaboration and partnership opportunities to support county government, come up with child care guidelines and policies, as well as legal frameworks. Operationalization of the 4th National ECD Stakeholders Call to Action, and planning of the 5th conference, which will be in Turkana. I would urge each one of us to start planning so that we can all go to Turkana and see how we can all make sure that children in Turkana also are part of us. Thank you very much, and God bless you.
Thank you, Lily, for keeping time and being very precise. Asante sana, let's appreciate her one more time. And clearly a lot has been done by the Early Childhood Development Network for Kenya, and just by following that footprint, you see the value of partnership and collaboration. Definitely a conversation that we'll continue having even as we continue with this conference. Now on to the next conversation around workforce development for nurturing care. This is so crucial because even as we speak about the ideas and the infrastructure being put in place, we need to have a workforce that can actually deliver these services for our children. Now, this is something that has been underscored in the breakout sessions we had in the morning, and I'm sure this will also be done in the afternoon in different capacities. As it has been said here, 90% of the brain's capacity develops before the age of 5, yet the workforce who serves young children is too often undervalued, underpaid, and inadequately prepared. So what can we do moving forward to ensure that we change this trajectory? Well, please help me in welcoming Evans Vundi Munuve Dixon. He is with the Ministry of Health. He is the program manager, actually, Nurturing Care and Child Rights and Special Needs in the Ministry of Health and the Department of Family Health, Division of Neonatal and Child Health. He has over 30 years of experience as an adept speech and language therapist, occupational therapist, with a history of proven results in improving patient outcomes. So ladies and gentlemen, we're in good hands. Welcome, Dixon. Karibu sana.
Good afternoon, everyone. This is Sivan Evans Munuve from Ministry of Health, Department of Child Health, and Division of Neonatal and Child Health. I think is the projection okay? So I'm here representing the Ministry of Health, and the end of division was to come, Dr. Caroline Mwangi, but due to other commitments, she couldn't, and I had to represent her. Talking about workforce, I would say we have done much about the workforce, because for one, we have never had a policy for ECCED, the gap of 0 years to 3 years. The policies that have been existing have been focusing on education. But we discovered that there was a gap between 0 years, a child of 0 years, and to 3 years. So at the moment, the Ministry of Health is developing ECCED policy. It is awaiting validation. Next week, 15th, is being added to the DG, and as stakeholders, 15, and then after that, we shall do validation. It is covering from 0 to 8 years, so that it can gap with the policies that are therefore, that has been developed before. So for now, I will just mention what we are doing in terms of developing workforce. And this presentation is about Kenyan context on all aspects of early childhood development. It is informed by what gaps are there, and these are informed by demographic surveys that was last done in 2015. But currently, there is the one that for 2022 that is ongoing. I think it started last week. So in the near future, we're going to have new data on Kenya Demographic Health Survey. So for this one, we can see the population of Kenya stands at 53,771,300, whereby annual births are at 1,505,629, whereby children under 5 are rated as 7 million plus, and we recorded under 5 mortality of 43%, or 43 deaths per 1,000 births. So the threats that come to the children are maternal mortality, which stands at 342 per every 1,000. And then we have low birth weight at 11%. And then child poverty stands at 29%, whereby this time we do not have data for violent discipline against children. We have a data for young mothers, that is births by 18 years, that stands at 23%. and then preterm birth stands at 12%, under 5 standing, whereby there is slow development, standing at 26%, whereby we cannot tell whether children have inadequate supervision because there is no data. So at least we can see there is a gap of developing a data dispository that could be giving the right projections. Young children at risk of poor development, they stand at, in 2005 was 60%, at 2010, 56%, so we can see there was an improvement, whereby 2015, it came to 45%. By sex, we can see girls in terms of risk by sex and residence, girls are better off, whereby boys are more affected. That is in sex, and in residence, in rural areas, children are more affected at 56%, whereby in the urban area is 25%. Estimates in terms of loss of earned wage because of these problems, it stands at 138%. A child with functional difficulty, there is no data, and the children with developmentally on track, there is no data. So this next slide is just shows the areas of nurturing care framework, whereby it's health, nutrition, and responsive caregiving, security and safety, facilitating environments. And in health, as a country, we are doing good, also in nutrition. But when it comes to responsive caregiving, we can see comparative country data is urgently needed. In other words, we don't know how children are cared for, whether there are any mechanism, whether we leave our children, whether it's a caretaker, whether it's a mother, whether it is in a home. We don't know whether these children are given that opportunity for us to know what actually the child is saying. So we have that gap, and it is one of the gaps that informed us to develop the ECCED policy. The other gap is in early learning. Early learning in terms of preparation of a child to go to join formal education. Early learning in terms of environment. Do we have playgrounds for the children? Do we have the right materials, culturally right materials for a child who has been born up to the age of 3 years? So there is no gap. So that was also informed that ECCED policy that the Minister of Health is developing, which should be followed by implementation framework. Existing policy support to the development of your children include neonatal, child and adolescent health policy, infant and young child feeding policy, Birth and Death Registration Act, Chapter 149, Early Childhood Education Policy, Kenya Advocacy Strategy for Nurturing Care for ECCED, and removal of users' fee for primary health care services for women and the children under 5 years. The other one is Free Maternity Health Care Policy of 2013. Key promise in nurturing care intervention implemented in the country. They include adoption of the nurturing care framework and regional launch of this strategy, which happened in 2018. There is also integration of the nurturing care framework into guidelines and tools, e.g. primary health care strategy, mother, infant, and young children nutrition policy, child and adolescent health policy. There's also inclusion of indicators on tracking development of milestones into Kenya Health Information System, which before they were not featured. And there was a successful fourth ECCED Stakeholders Conference held in October 2021 in Siaya County, where the Minister of Health was represented. The upcoming, or rather now it is ongoing, KDH, since last week, KDSH 2022, whereby it has a module that you give current status of ECCED. Meaning we shall be able to get updated data on ECCED. There is also inclusion of care for child development guidance into maternal child handbook. Development, in this, we have captured even development or milestone in that maternal child handbook, which goes with the mother. So at least we are able to track the development of that child. If there is delay, whether there is any issues, there is a timely referral, appropriate referral, and the management of those children. There is also development of care for child development training curriculum for healthcare workers and for community health volunteers, so that at least they are able to monitor these children at the community level. There is also development of an online training curriculum on early childhood development for pediatricians. And the other one is plans to collaborate with medical training colleges to include nurturing care framework introduction in the upcoming curriculum. Just to mention this, in Ministry of Health through KMTC, there is a training of occupational therapists, and they do normal development of children and also the pathology. And they're able to identify the needs of children, and also they're able to give that developmental stimulation. So if this ECCED is nurturing care framework, it is incorporated the curriculum to KMTCs. Actually, it will just pick up. And also other universities like JKUAT, St. Paul, and also Moi referral teaching also. So at least there are set up structures. It's just having the curriculum developed and rolling it over. So this one, recommendations for care for child development, I will not go through, but it just shows how child develop from zero. They are born. There is every need for every stakeholder, for every parent, for every caregiver to know the development of milestones of our child. And as I've said, they are captured in the mother-child handbook. So we can always look at it. It's a handbook that is rich in data. So what are existing? There are existing cross multi-sectoral collaborations to scale up nurturing care. Whereby multi-sectoral technical working group, which was formed in 2018, like it has been mentioned by ECCED network, but challenges is also in operation. At the MOH level, there is a technical working group that brings together other line ministries with focal person represented with MOH as the lead. Those include Ministry of Education. We have also National Council for Children's Services, among others. So, and also there is MOH is part of National Early Childhood Education Committee, Parenting Technical Working Group, and also a member of committee reviewing through care policies and the care of policy and the care of children in contact or conflict with the law. There is also collaboration development of Kenya prisons child care policy and the capacity building program for caregivers at the prisons. I don't know whether they have, it was ongoing, they have a policy that is ongoing. I don't know whether it has been validated, has it? It is ongoing. So at least this ECCED policy of Ministry of Health and the one for HPS, at least we take care of our children who accompany their mothers at the prisons. And as I also have said, we also collaborate with the National Council for Children's Services, who are the overall coordinators of matters of children. So here just a list of key stakeholders. Maybe I may not go through all of it, but we have Ministry of Health, other departments like State Department of Social Protection, Ministry of Education, Ministry of Agriculture, Ministry of Interior and Coordination, Department of Civil Registry, and together with your functions towards the welfare of the child. What are the challenges? One of the challenges is multi-sector coordination still remains a challenge. And the other one is the resource allocation and the mobilization strategy. And also the evolution of healthcare, whereby when it comes to the evolution of healthcare, the Ministry of Health, national government has remained as the policy, at the policy making. And the counties actually own the ECCED, and actually they are the implementers. So mostly we depend on their goodwill. So that is also a challenge. Devolution came with that challenge. Even though it took the services closer to the citizen, there are also those challenges. Lesson learned with Siaya County, there is a model on multi-sector collaboration. We also are buying at highest level of leadership, which is very important. And we have been using innovative training models so that we can accommodate everyone, even at the community level. We're giving recommendations on support needed to accelerate the adoption of the nurturing care framework, whereby we need to finalization of ECCED policy and the advocacy strategy and the dissemination. Implementation strategy, we scale up capacity building of HCWs and the CHVs, National Parenting Program, and the pre-service curriculum. We also need to develop and utilize scale-up models for nurturing care for early childhood development. We also need to have regional centers of excellence that have best practices and can be a learning hub for surrounding regions. We also need to have integration with the other key policies. We also need to strengthen multi-sector coordination and leverage on universal health care. We also need to include inclusion of more indicators for tracking of development. That is so. Asante sana.
Thank you. Let's appreciate Dixon one more time. Okay, so let's look at our neighbors and see if we are still together. Naona watu wameanza kugawa mashamba. Hello, are we there? Okay, is your partner doing you well? Ama nakupararisha? Mwamshe jameni, mwambie maji yako mengi. We'll pass them around, tafadhali. Let's stay awake for one more presentation, and definitely remember you have leeway to ask any questions for any of the speakers in this plenary session, and after that we shall break out to our individual sessions. Now, when we talk about nurturing care, this has been talked about and being literally the core of what we're talking about here in as far as enabling ECCED. Now, nurturing care refers to a stable environment created by parents and other caregivers that ensures good health, nutrition, safety, and security, early learning, and responsive care. Now, children need all 5 domains of nurturing care to meet their developmental potential. Now, a nature or nurturing care framework recognizes the critical importance of an enabling environment and the role that multiple sectors play across the life course to protect, promote, and support brain development. So how can we ensure that we harness this for our children under the ECCED? Well, it seems that we have some best practices that we can borrow from Siaya County. I'm hearing good things with the Smart Start Siaya, and would like to hear from the Mama County about Smart Start Siaya in a moment. Her Excellency Rosella Rasanga, forgive my mountain tongue. Her Excellency Rosella Rasanga, please if you can come to the podium. She is the First Lady of Siaya County. Rosella has used her platform as the First Lady of Siaya County to spearhead initiatives that touch the underserved in the community. She is a champion of Wadagi Initiative, a program that promotes maternal and newborn health by encouraging women to give birth in hospitals. Rosella also leads UMPED, a mentorship program for adolescent girls from disadvantaged backgrounds. Karibu sana Mama County. Let's appreciate her again.
Good afternoon. I now know you could hear me. Sorry, I think. My name is Rosella Rasanga from Siaya County. I'm really honored to stand before all of you to speak about Siaya. I'm honored on behalf of the Siaya people and the Siaya team that is here, and also my colleagues, the first ladies, for also supporting this noble cause on early childhood development. I think we are all here because of one thing, the children. And we are who we are because of our early childhood. And I think all of us who are here are proud of themselves. Aren't you? You are not proud? Because we know millions of other children don't have this kind of opportunity even to sit in this place. So for me, I would want you to applaud your mother, your father, or your caregiver who stimulated you enough, who nurtured you enough to be what you are. Makofi kwao. So today I want to thank Uthabiti for also giving me this opportunity to come and share the Siaya story, making nurturing care happen. It has happened in Siaya, and it is a movement. And so, mutanisamea pia, because for long I've not done a presentation like this. Unajua kwa siasa unaongea tu. You know, they say verbal diarrhea sometimes. But today I'll present on a PowerPoint, and I believe the person who's doing this can also assist me. We'll go to the first slide. I want to give you our story. How it started is usually very important to give the history. Our history, Siaya history, started with the governor. When we went to Harvard University for 2 weeks to study with some of our partners, PATH, KIMET, we can see the executive director, and we can see the PATH team, the WHO team, and the county staff of Siaya. So many people in Siaya could not imagine that a whole governor can be away for 2 weeks studying about ECCED. Why they could not imagine that? Because most of us, we have never taken ECCED seriously. I was also one of them, I confess, today. Because I thought all along, even when I was bringing up my children, that early childhood development starts only when I'll take my child to an ECCED center that has a very good foundation, forgetting that the early learning years start at 0 to 3 years, where the brain of a child develops very fast. And so what we are saying here, when we are seated here, ladies and gentlemen, is that we are here to see how we can help millions of children who do not have that opportunity. And if we can do that, then we can have a bright future for our nation and for the whole world. So governor went to Harvard. And when he came back, the team that was with him in Harvard told him, we know, Governor, you are very busy with building roads, schools, water projects, and everything else. For this thing not to lose its importance, we want you to loan us your wife, the first lady. He agreed, and he loaned me, and I've gone for good. He won't have me back where I was. And so I'm here today. I'm one of the greatest champions for ECCED, because I think this is the missing link that we really need for our children. We do so many things for children when they're adolescents, youth, women, and we forget the young ones. And when we do that, we start crying at some point. So he loaned me to this team, and today I'm here, courtesy of him. He knows I'm here, doing what I do best. And so, when they came back, they appointed me as the patron of Smart Start, Siaya. Before that, we had not called a name, but they appointed me as a patron, and the first thing we did was to have a committee of government officers and partners that we could sit together and see what we can do for Siaya. And so, Smart Start Siaya project was conceptualized. So our inspiration on even why we said Smart Start Siaya, because we said we want to start smart. We know some of the results, we may not see them immediately. We'll see them for years to come. But I can also tell you, even in this room, I have Siaya staff who have accompanied me. For one reason or the other, I realized that there are so many people who we have trained, giving birth to babies. I don't know whether they wanted to try it out. But most of them have also come back to confess that the children that have given birth and doing what they have been taught, they are much, much better. Isn't that evidence? If they have given chance, I know some of them will be able to talk. I know Nancy, you are here. I know Orange, you are here. And many more they are here. I know they are laughing. Some of them even have grandchildren. And they are saying that there are things that really they didn't know. Me included, I never knew. If I'd done it better, maybe I'm here by default or by design. And some of us are, because our grandmothers also did what they are doing. Because what we are saying here is not something new. It's something that our parents or our grandparents did, but we forgot. And we are also seeing the support system that our society had during those years. We don't have them. A young girl, an adolescent girl gets pregnant, does not go to the clinic. You know when she's going to give birth. And when she gives birth, she does not know how to take good care of that child. And when they turn out, the child is delinquent. And years go by, and it is a cycle. And so, those who have tried, as I said, have a story to tell. If you have time, you can seek them out. They'll also tell you. So we said, there's a saying that if you change the beginning of the story, you change the whole story. So see, I wanted to change that beginning. And we can see that as a movement, we are going ahead to change the story of Siaya, because we know there's a place where we were before, and we want to be there where we were before. In Game, there's a place in Game area, just one part in Siaya. They say that if you throw a stone, the likelihood of it, landing in a professor's home is very high, those years. But these days, they are not there. The professors that are there are 80, 70 years. But these days, they are not there. So what happened? We are saying we want to go back to our lost glory. And so, I think we have built a case on why nurturing care is very important. I don't want to repeat what we have said, because we all agree that nurturing care is very important in the early years, and they are crucial in influencing our health and social outcomes. And even as research and evidence has shown that challenges that we are having right now on issues of mental health problems, that is now very high, obesity and stunted growth, heart disease, they have their roots in early childhood. So why invest in nurturing care? We have also built a case here on why we should invest in nurturing care, because our future depends on it, and our ability to foster health and well-being of our next generation. Today's children will become tomorrow's citizens, workers, and parents. The 1,000 days, we all know that is very critical, and we also know that children can grow best in a good environment, which also includes safe and secure surrounding, responsive parenting, caregiving, adequate maternal and child health, care, nutrition, and opportunities for stimulation. I want to pass through that because we have the person who have talked, the Ministry of Health. They are doing quite a lot on this, and also the Department of Education. So the former UN Secretary General also said on sustainable development goals that taking action to promote ECD at the highest political is the highest political action that can help drive and transform what we hope to achieve in the next 15 years. Those were for the development goals. But again, what I also want to say for CIA, that what we tried best, because we know if there's no political action, then we are going nowhere. We started with our members of the county assembly. If you don't do that, then you'll find the landscape is very slippery. One thing I realized even before Governor did this, he had put a budget for milk for ECD children. Mnakumbuka wale wa maziwa Nyayo. So I wanted to bring the same in schools because it also helps in registration. More children come to school, and also to help the nutrition needs of the children. The first thing they did was to shoot the budget, so it never passed. But again, when we involved them for training, because that was not the agenda, for us, we wanted to get a political goodwill for them to be able to support this program. And they told us, and they confessed, that if we had known before about this, we would never shoot down anything that touches on children. And they even told us, bring it on, we'll pass anything to do with children. And some of them have even gone ahead to start school feeding program. And so I think some of the successes that we can attribute to is the political goodwill. And I cannot fail to mention also the executive has been very instrumental. The governor is the driver of this program, and we always say that he's the driver of the bus. For CIA, it was the bus. But now, the last training we had with directors, they told us it's no longer a bus. Madam, this is a train. Yeah? And I don't know after a train what it would be. Maybe there's something bigger than a train. Why is it a train? Is that everybody is on board, and everybody is included, because everybody needs to do something for the children. And so we have done a lot of trainings and sensitization. And what I like about ECD training and sensitization, and especially when you take them through the science of ECD, it makes you understand that if you start early, even for the fathers that were here, because I've seen fathers myself, I'm living in the village, you ask maybe your worker, have you even carried your baby? They say no. Yeah? You are waiting to carry your baby at what time? At what age? I can not say mine did, because even mine did not. But the good thing was that, the society was there to give support to these children. So what you are saying, that male involvement in the development of their children is also very key. And so we are saying that there's nobody who is left behind. We have also trained our chiefs, because we have the 5 components. I'm looking at mine and that one is ahead. Okay. Sorry. Let me go to why develop policies. We know why policies are very important, and especially during my tenure, we are trying to fast track the policies that have not been done. The last one that has just passed recently is the one for agriculture. As I said, we are having our guiding principle actually is that our model is a government-led approach. When government leads, you are sure of sustainability. And for you to be assured that they'll continue with it, it has to be embedded in the law. So that whoever comes, successive governments cannot ignore that component of ECD. And so for my tenure right now, I want to gauge my success with the policies that are going to pass that integrate nurturing care into the service delivery, all service delivery platforms. And as I said, our multi-sectoral approach includes everyone. We have partners. We know partnership is very important, because actually with this program of ours, the first people to hold my hand was our partner Path and KMET and Child Fund that are here, and part of it World Bank, UNICEF, SCORE ECD, what do they call them? Sorry, SCORE ECD program. There are many of them, I may not be able to call them, but I've realized that when there's partnership, you can move and you can do a lot. So they moved with us into this program, and what we want to do is to move forward and make sure that all these policies have been passed, even as we continue. Time. Okay, sorry. Okay, I'd said policies, enabling policies. So example of the policies, these are national, are universal health coverage, the tuition-free, primary education, paid leave, maternal leaves, and parental. So I come to the gist of my presentation. Is the Smart Start CIR model. It has evolved from understanding that opportunities for nurturing care exist. As I've mentioned, it's a multi-sectoral approach. And then we also acknowledge that available opportunities can be tapped and be enshrined into the legal and institutional frameworks. So let me mention the activities that have supported the scale-up of nurturing care is good governance. As I mentioned, the governor is the driving seat, and I'm the conductor, and the rest are passengers. None of them have alighted. In fact, most of them are boarding the train. And then there's coordination through establishment of nurturing care multi-sectoral collaborating committee that is chaired by our ministers. As I'd even mentioned that this thing is not my program, it's the program of government, but supported by partners. The enabling environment that I said, I mentioned, and also capacity buildings across all sectors. All CHVs, community health workers, have been trained. They are the ones, the point of contact with the community. They know who has given birth where and who has not attended his or her clinics, and they are able to pass information on nurturing care to those who need it on the ground. And then also we engage innovative advocates as local champions to drive change and sustain caregiver engagement. We have trained religious leaders, and religious leaders actually are the best, because when we train them, they took it full throttle. We even have priests, Catholic priests, who are major, they go to major forums and they speak about nurturing care, because you know, when the society is rotten, then they also have a big problem in trying to bring them back on track. But when they saw that if this thing is the missing link in how children can be brought up, they'll have less cases in settling disputes, even within families. And so they have taken it up so well. They do it in churches. Some of them have even created play spaces for their children, and also making caregivers recognize that early years are very important for them. So results and some milestones. As you see that we are focused in improving outcomes for young children, and then we are prioritizing and taking lead in mobilizing resources for scaling up nurturing care for early childhood development. Out of the SIA model, it has grown, and we have also given birth to more babies. We have 6 babies. Then Lake Basin, LREB counties have been given support to continue and to start nurturing care in their counties. I think there are 6. I can mention a few. Kisumu is one of them. Kakamega, and the rest. And then also we have launched a communication campaign that is very successful and ongoing within the county. We have a rallying call in Doluo. It's called Nyathien Mwandu Miemise Motegno Chon. If you ask anybody about that, they know. So it's something, can I translate it? Mtoto ni mali. Ukimpatia, Kiswahili si mdomo yangu, if you give them a good foundation, you give them good foundation early, a strong foundation early, then you don't go wrong. Based on this Smart Start experience, nurturing care for ECD has been adopted as a strategic service under the Kenya Community Health Policy 2020-2030. So what are our next steps? We know we can do much, but again, sometimes you may do so much and then you do so little. So right now, what we want to do is to target vulnerable children and also children with special needs, so that we can give them targeted support within the community. People ask me, what will you do after this? Si unaenda kuacha after 6 months? I know that is a question that people have asked me, but I said that I'll continue being a champion. For the person who will take over, who wants to take over, I'll hand over the baton and also continue moving with you guys. If they are not interested, then we are still there. It's a movement that is unstoppable. And then we also have, we advocating for more resource allocations and investments. We know that government cannot, do everything. I know that there are partners here, and I saw World Bank saying they have money, and that money will look for it. Yeah, we'll follow the money where it is. And I know there are organizations here that also have money that can assist us. It's for only us to ask. So when we come as First Ladies, by the way, as First Ladies, we are ready to go to the trenches. And that's why they have seated here up to this time. There's so much we are doing on the ground. Give us little, and you'll see what we can do with the little that you have given us. There are times we are called to be champions about something, just for the fanfare. After 3 months, some people disappear, and you don't see them. We know as government, for us, we are not given any support. We don't get any support from government. But the little that we get from partners goes a long way in ensuring that we do much. So I was told to wind up. That is the problem I have when I start talking about Smart Start. There's so much I've left, but I won't say now. I know it will come up in the plenary. I want to thank you very much for listening. God bless you.
Thank you. Let's appreciate Mama County in the right way, the way we do it African style. Let's appreciate the First Lady's job well done. And it is so encouraging to actually have best practices right here in this country, right? So again, let us appreciate the steps that we have made so far. And well done to Sierra counties and other counties that are following suit, because we need to say we are doing something, and of course it will attract the right investment and partnerships as we push this agenda forward. Now, time is so far much gone, and at this point we cannot even take the questions we wanted to take in this forum, but we are breaking into those breakout rooms, and you will have time to ask these questions even as you engage with your panels in the sessions. Now, there are 3 of them like we had in the morning, so we will really need to do a quick changeover to ensure that we give each other time, enough time to present and also engage in question and answer. This afternoon, we are looking at the Nurturing Care Framework. It has been touched on, but we'll delve further. Session chair will be Ruth Mwendo, Rapporteur Gloria Gathure, and this will look at playful parenting, other innovative programs for children 0 to 3 years, the Madrasa Early Childhood Program. They will also be looking at maternal stimulation and early child development in sub-Saharan Africa, evidence from Kenya and Zambia. Integrated management of newborn and childhood illness, quality of care assessment in Kakamega County, Kenya, policy lessons from implementation of care for child development in Kenya, Uganda, and Tanzania. And of course, there will be county presentation from Nakuru County. That will be breakout session 1 on this end. The second session will include and will be focusing on inclusion. This is so key even as we move forward, because every child, whatever background and whatever circumstances or their health status, needs to be catered for. Now, they will be looking at strengthening legal and rights framework on early childhood education, care, safety, and through care management for children accompanying their mothers to prison. Incorporating ECCED daycare centers within TVETs in informal settlements to allow safety and better child development as young mothers access education and skills. Training and development needs of the legal workforce, a lever for promoting child rights and services for at-risk children. This will be chaired by Eva Nyoike. The rapporteur will be Adiu Chol Chiman. I have no idea if I just mentioned that the right way. Forgive me, but that will be in session 2 on my right. Then in session 3, that will be in Mount Kenya A, all the way down the street, and you'll be shown where by the ushers. They'll be looking at the workforce development challenges for caregivers and childcare entrepreneurs. This has been touched on especially by the Ministry of Health, but let's have a session to delve further. They will be looking at improving the quality of childcare centers in Nairobi, informal settlements through supportive assessment and communities of practice using existing government systems. Also, they will be focusing on barriers to an enabling nurturing care environment for children under daycare settings, and there will be county presentation from Taita Taveta County, and of course experience sharing by caregivers, because we need to hear from those who know how this shoe pinches. Kidogo will be presenting, and the Action Foundation. Again, that is the 3rd breakout that will be outside this plenary hall. So ladies and gentlemen, let us move out of the plenary hall so that it is set up, and then we can continue with our respective breakout sessions. Asanteni, and after this, there will be tea, and we can also leave and prepare for tomorrow, where we'll delve further into other matters that are very key in the ECCED space. So thank you again for your participation today, and enjoy the breakout sessions.
researcher on ECCED. That will be followed by a presentation from Kakamega County, looking at integrated management of newborn and childhood illness, quality of care. That presentation will be done by Rose Muhanda, who's a community health specialist coordinating ECD work coordinating child health within the county. And then the last presentation will be made by Joyce Marangu, who is the manager ECD Workforce Hub at Aga Khan University Institute for Human Development. So I'll request that we go straight. Apologies, we have our last presenter. Our last presenter is Millicent Yugi, who will be presenting on behalf of Nakuru County. So we'll strictly give 10 minutes for the presenters. We'll try as much as possible to minimize any hitches so that we have sufficient time to move forward with engagement from the floor. So Masad, kindly go ahead with the presentation. Asante.
Well, good afternoon, ladies and gentlemen. Thank you very much for this opportunity. As you have been told, my name is Masad Omar. I'm the program director of the Madrasa Early Childhood Program Kenya, which is an affiliate of the Aga Khan Foundation. I'll be taking you through a very brief presentation around playful parenting and other innovations for children and their families, children 0 to 3 years. I hope at some point the presentation slides will come up. So the Madrasa Early Childhood Program, for those maybe who are coming into contact with it for the first time, is a program that was established way back in the 80s and is working very closely within collaboration with county governments, with other stakeholders on the ground, and most importantly, communities and families. Look this way. So next slide, please. So over the years, the program has been implementing different initiatives, and these initiatives are targeting 0 to 8 years. But for today, this afternoon, I'm going to present mainly around our initiatives for 0 to 3. Looking at how we approach the element of play, or the component of play at the program, is we have around 5 components that are actually guiding and supporting how we do or ensure we reach to child-friendly play engagements. And these include materials, manipulation, support, language, and I want to believe the other one that is not showing is choice. So these 5 ingredients are actually like the driving force in terms of how we engage with communities. And each one of them has a detailed sort of, I would say, detailed story behind it. But in the interest of time, we may not be able to tell all that today. I'll quickly touch on that. Around materials, we are looking at, for example, locally available resources and how these can be actually converted into age-appropriate, attractive play materials for children. And also the other ingredients in their specific ways. So for the presentation this afternoon, I'm going to share our experiences around the approaches that we use in undertaking playful parenting. So we are working very closely within the community health strategy, that is with community health volunteers, with the county health departments, with the dispensaries, health facilities. And what we do is we have adapted the Care for Child Development model and actually used it to train the community health volunteers. And in the course of the training, we know that these are the touch points. These are the people who reach the parents at household level. So in addition to just the training and caregiver and CHVs to reach out to parents on aspects of play, stimulation, and communication, we have also added on components on health talks at health facilities, where we encourage and support that when caregivers visit health facilities for different services, they can be able to also hear more about what they're doing and through health talks and get more support. We have worked to establish child-friendly spaces in health facilities where children who are admitted in the pediatric ward can be able to have access to play materials and be able to support them in their recovery process. And we have seen a lot of good results in that. Next slide, please. We have worked through the, again, support of collaborators to be able to develop what we coined as My Brain Power Pack for households and families in Kilifi. And we developed home play packs for children 0 to 3 in collaboration with families and communities. We put this in a pack very attractively and were able to distribute to communities just as a way of encouraging play at family level. We usually do rapid assessments and dissemination of key findings in order to encourage cross-learning and share experiences around what we do. Next slide. So during the period where we had long school closures, actually the pandemic 2020 on the onset, we actually, through a rapid assessment, established that it was possible to engage with families and caregivers using simple SMS and WhatsApp technology to provide simple key messages for caregivers to use around age-appropriate activities that they could be able to play and engage with their children, all in the effort of stimulating child-caregiver positive interactions. We receive a lot of feedback from the ground, and this includes children are very happy, caregivers are very happy, they are settled, especially during the anxiety period of COVID, and were able to effectively engage with their children while at home. On this slide, I'm going to show or share a little bit about the results that we have seen so far. And on the top right, what I have there is a photo of children playing in a health facility in the burn unit, where the children, especially one, actually the name Tony, had very severe burns, and at some point the caregiver was equally distressed because Tony could not stretch his hand to play, and therefore there was an indication that maybe Tony would require physiotherapy support. But through play, Tony gradually was able to stretch out his hand and play very well, and that led to quick recovery for the child. We are seeing a lot of other caregivers engaged in play with their children, including fathers' involvement. Next slide. Yeah, just a testimony of caregiver engagement with their children using various materials. Happy mother, happy child. So positive interactions there. Next slide should be the last one. Yeah, again, emphasizing on positive caregiver-child interactions. So with that, I say thank you very much. There's a lot more to share, but I think time is not so much on our side. However, I encourage you to check with me, and we can talk a little more about playful parenting. Thank you.
Thank you. Thank you, Masad. We'll transition to the next speaker, who's Silas Anyango. Thank you very much for keeping time.
Thank you so much, Ruth. And thank you also for your presentation. It's interesting. And those that are listening, thank you. I want to present something on a study that we did here in Kenya, in Kisumu, Kisumu County, and also we did the same in Zambia, in the central province of Zambia, and I found it relevant here, and I'm happy to make this presentation. It's a big study that had a lot of outcomes, and in the interest of time, I see how Ruth is looking at me. I will not go into details of that study, but the principal investigator of that study, Dr. Patricia Wekulo, is also here. We can have a chat if you are interested. There were a lot of other components that were being investigated in that study, but I picked up an aspect of maternal stimulation, which was an aspect that was emphasized in that intervention. And then I looked at it vis-a-vis its association with developmental outcomes of children. And the next slide, I learned my lessons in the morning, so I carried my own slides here. I will present on, tell you a bit of the background of this specific study, but a bit of the methods. Then I will go to results. And I want to say that if you have problems understanding some of these figures that I will be talking about here, it's fine. We will talk about them. And then conclusion together with a bit of policy implication. The next slide. We know, and this has been said on several occasions, that child survival has actually improved. There have been a lot of emphasis on this in the past 3 decades. I think it has improved by about 59%, and children are now surviving more than they were in the last decades. But even with this great improvement in child survival, especially due to improvement in health system, governmental and non-governmental interventions to improve this, studies have shown, recent studies have shown that majority of the children living in low and middle income countries are still at risk of poor development, that is, risk of not achieving their human potentials, that is, not achieving the required milestones at a given time. And one of the contributors of this has been maternal stimulation and limited opportunity for early learning at home. Maternal engagement and stimulation are some of the critical inputs for healthy development to help children achieve their developmental potentials, but there are little evidence or relatively little evidence on this, and so this paper comes to identify the associations between maternal stimulation and its relationship with child development, because we don't want to tell parents that do stimulation, but then where is the evidence that support whatever we are talking about? There are a lot of programs that are going on that are encouraging mothers to get into this, but then very little evidence, especially on the published information that can support this. And so this paper aimed at supporting this evidence and giving this evidence so that when policy implementers and also program implementers are talking about this, at least they have some backing. And this paper was done in one of our counties here in Kenya. And we can generalize it in other countries because we did it in 2 countries in sub-Saharan Africa. So we aimed also to identify which of these domains are most predicts of the developmental outcomes. And I want you to move to the next slide. We only did a descriptive kind of study, which we were still not allowed to get deep into that and see how the intervention worked, but we analyzed the relationship between maternal stimulation and from this longitudinal study that was conducted between 2018 to around 2021. And then in Kenya, we had about 220 families, that is caregivers and their children, but in Zambia, we had about 340. And then this moved to, at least we have some laws to follow up, people who did not want to participate, and then that's what happened. And next slide. Under our variables, our exposure variables, were maternal stimulation activities in the areas of cognitive, areas of language, areas of motor, that is both fine and gross motor, and areas of socio-emotional development. And this one we just collected via questionnaires where we were asking the mothers if they carry out or they were participating in this, some of these activities. And then we were actually relying on their self-report. The answer was yes, no, did you do this, yes, did you do this, yes. And then our outcome was looking at child development, which was measured through ages and stages questionnaire. Some of you know this, but then even if you don't know, it's fine. It is just an assessment, one of the assessment tools that is used to measure or to assess children's development. And it also relies so much on caregiver reports. And then our results from the 560 we interviewed at baseline, or post-birth one, or round 1, and 4, 5, and 300. But then when we looked at the unadjusted, this one we have not taken care of issues to do with education of the mother, income, and so on and so forth. We found a strong association of about 0.55 SDs. I said if you don't understand, there is no problem, but it shows that there is a strong association with overall development. That was at round 1. Then we again assessed this again at round 2. We still found a strong relationship, and then at round 3 also a strong relationship. This is when we take the overall maternal stimulation activities and then we add them together, and then we did a regression and found that result. Even after we have adjusted for other household income, a lot of other activities, the results were still similar. And then we looked at this also per round on the domain specific. Now we are saying if the mother practiced, because some mothers did not practice some of the activities, like for example, they were only doing cognitive stimulation, but they did not do anything on social emotional. So we wanted to look at them separately. We found that cognitive activities were associated with development, and in those ratios, in those coefficients presented there. And also social emotional was also stronger. At round 2, we found language was strong. Language activities, that the mother reading with the child, the mother talking to the child, the mother singing stories, we found that it also improved overall development. And also at round 3, it was motor activities that included fine motor and also gross motor. When we combine all the activities together, we made one variable combining all the activities together. We found largest association with personal social, which is socio-emotional, but also found smallest association was found with gross motor domain. That is on the specific ages and stages domains or the specific milestones. And then at round 1, we have that, and round 2 and round 3. Then when we go to conclusion, just go to conclusion. When we go to conclusion, we found that our study suggests, we are using a suggestion, it's not that we are confirming, we are using suggest large positive association between maternal stimulation activities and children development in poor rural settings, because this was done in one of the most the criteria that we used to identify the study site was the poor indicators. So stimulation activities by the mothers really improve developmental outcome of children. And then these activities are also, one, they are relatively easy to carry out. They require minimal materials, and also they do not require too much time. I think this is what most organizations have been talking about, cost effectiveness. They are available, they are easy to do, and therefore it is something that we should focus on. In terms of policy, we suggest that programs encouraging caregiver-child interaction should be highly emphasized because they are effective irrespective of where the child grows or irrespective of the nature of the child. And also, for us to improve early childhood development, we suggest to policymakers that they should consider programs that support caregivers. Caregivers need support to invest more in stimulating activities, and also programs that integrate, programs can be integrated into existing social infrastructure, health system, or social infrastructure like cash transfers and so on and so forth, but also health systems and even in communities where the children live. This will help children also in terms of their growth and development. And these children were about 3 to 5 years old, but we think that strong association could also be seen for the younger children. Thank you so much.
Thank you, Silas, for keeping within your time. I'll request the next presenter to go up on stage. I'm prompting you at your 5th minute and 1 minute, so pace yourself. Thank you.
Good afternoon. My name is Rose Mohanda. With me, I have Frederick Makoha from the M&E department. We are from Kakamega County Department of Health. I recognize other members from Kakamega, and one of our CECs is seated here. Maybe he can just wave. Thank you. I'm going to present to you an assessment report of one of the assessments we carried out in Kakamega County, just evaluating how quality of care services were being offered to our children, and that is integrated management of newborn and childhood illness quality of care assessment report. Briefly, I'll talk about the profile of Kakamega. Next slide. Profile. Kakamega County is one of the populous counties. We have a population of about 1.9 million people. Of interest that Kakamega has 12 sub-counties and 400 administrative community areas. Our health profile, we are one of the counties with many facilities. In total, we have 13 hospitals, of which one is our county referral hospital. We have 117 dispensaries. We have 61 health centers, and we are fully covered by community health units. That is 422 health units. Our under one, we are estimated to have about 61,000 children under one and 240 children who are under 5 years. The rest I can give to you. Why did we do this assessment? We noted that in this country, integrated management of newborn child health illness model was adopted in the country in 2000. And Kakamega County being one of the largest counties, we had also trained quite a big number in the complete curriculum of IMNCI. So we had trained 200 health workers and therefore expected that they will provide quality of care to our children. That did not happen when we still noticed that we were losing again several children who could have been saved because the health workers seeing them had been trained. Why now what was the purpose of this study? We then sat down, that is a few of us, to examine and identify the strength, gaps in management of newborn and childhood illnesses in health facilities across the county. And that is, we selected those main facilities that this assessment was done. So we had two main questions. One of the questions was, what was the capacity of health facilities in Kakamega to provide quality integrated management of childhood, newborn and childhood illnesses? And the next question was, what was the quality of the service the healthcare provider was providing? So we looked at the health facility, the infrastructure, and then we looked at the healthcare provider in terms of provision of this service. Next. The methods, this was an observational cross-sectional assessment. It was assessment, and we developed a structured checklist that we used to collect data on the quality of care services which were being provided to our children in these facilities. And selection of facilities and healthcare providers was purposive, and therefore we analyzed the data using AP Info and gave our results as follows. The number of facilities we assessed were 39 facilities in Kakamega County, and we were able to assess 49 healthcare providers seeing the children. So we sent IMNCI assessors to the field, and they were able to assess 49 health workers. But again, 473 children were able to be assessed. I want to give a summary of key areas which touch on development of children. And on triage. Triage is when the children come in and you want to find out which child is very sick. So we found out that more than 80% of children who were seen, their temperatures were taken, recorded, and they were able to be given pre-referral treatment. But of interest is only 44%, that is less than half of the children who were seen, less than half, mid-arm circumference was taken. That was very sensitive, and you know, MWAC is very important tool that we are using to assess the nutrition status of the children. And again, less than half of the children who were assessed, oxygen saturation was also recorded. Even where we had the equipment, less than half were able to take oxygen. On history and examination, I'll only pick areas of interest on child development. HIV and TB exposure, developmental milestones and interaction, communication and responsiveness were checked in less than half of those children. You take note that it's important that we assess the HIV status, TB exposure, but that was not being done for those healthcare workers who were assessed. So again, the risk of identifying children who were exposed would not be picked by these healthcare workers. In terms of immunization did quite well. The immunization assessment, that one, the health workers did well. In counseling, again, when we are talking about child development, it is important the caregiver or the mother is counseled. But in the facilities where we visited, less than half of the caregivers were counseled on conducting appetite test or even on care and development of these children. So we took note that we may be seeing children in our health facilities, but we take very minimal time talking to the care givers or the guardians or the parents. And in the initial presentations, we took note that even with the mother-child booklet, health workers are not able to refer to counsel this mother. So that also came out in our study as indicated. Vaccination, when we also looked at the results, all the variables of vaccination, the antigens, they scored quite well, and that was above, most of them scored above 90%. So immunization, we are doing very well. We just noted that health workers immunize the children, but they rarely talk to the caregiver or the one accompanying the child. Again, what we got is availability of the mother-child handbooks. That was not available in most of the facilities, and therefore, that is a major gap, that if we don't have the MCH handbooks, then you are risking even the documentation of the antigens being given to these children and even exposing them to more infections. Only 67% of facilities which were assessed had the mother-child handbook. In summary, other results were the health workers were not following the IMNCI chart booklet, and you know it's a sequence. So they were not following the chart booklet even where they are. They missed some steps when seeing these children. But in time, they took about 10 minutes to see these children. And it is important that we go through the assessment using the chart booklet well. So the assessment revealed that none of the assessed service providers followed the guidelines. In line with prior evidence, the assessment revealed that challenges to implementation include low in-service training, poor adherence to the guideline, and we found that support structures have influence on IMNCI implementation. We have 3 key recommendations, and the first one is very key to us, that the Ministry of Health does not have a standard pediatric quality of care assessment tool. And therefore, each county is using its own maybe developed tool to assess. So we may not be seeing these children uniformly. We are recommending the Ministry of Health to develop a standard pediatric quality of care assessment tool which will help us improve IMNCI service delivery in this country. And that we have, as Kakamega County, we already reached to the ministry because the Ministry of Health participated in this assessment. UNICEF supported us to disseminate this report to all stakeholders. And we want to adopt as a county or as a country, we are recommending that we retrain people, whether it's on-job training, whether it is through mentorship, CMEs, so that they can be able to see these children in the manner IMNCI guideline recommends. We want also to recommend provision of adherence to the guideline and job aids at all service delivery, because again, job aids is a key issue. So we want to appreciate UNICEF for supporting us to disseminate these findings to the county stakeholders. We want also to appreciate the Ministry of Health for participating in this assessment, which was an eye-opener to the country. Thank you very much.
Thank you. Thank you very much, Rose. Joyce, please take to the stage.
Thank you. Good afternoon, everyone. This presentation is about the policy lessons that we have learned from the implementation of the Care for Child Development in Kenya, Uganda, and Tanzania. So a little bit of background on this Care for Child, the status of Care for Child development, the status of children in the region. We know that more than 250 million children are at risk of not meeting their developmental potential throughout the world. And our region, particularly Sub-Saharan Africa, is one of the most affected by this. And the reason for this is because of high poverty levels and inequality. This morning we heard that inequality between the wealthy and the poor has not reduced in the last decade. However, indicators such as stunting have improved, although we saw recently that this was affected by the COVID-19 situation. When you look at the East African countries, that's Kenya, Uganda, and Tanzania, the ones that are relevant for this presentation, you find that all of these countries are pretty much comparable when it comes to child mortality rates, for instance, in that although this has declined recently, we still have really high percentages, in that these deaths are preventable through interventions that are known to work, and there is evidence that there is some evidence that these interventions work to reduce child mortality. And one of these is the care for child development. And for those, I know that a number of people are familiar with this intervention. It was developed by UNICEF and the World Health Organization, and it aims to build caregivers' capacity to be able to provide responsive care for young children and improve child development outcomes. So what you can see here, okay, on the package itself has a number of items to it. It has the participant manual. It has a technical note that explains the package itself. And there is also a monitoring and evaluation framework that helps to track data on the implementation of this package. So this intervention is what we studied. We studied organizations that have been implementing the care for child development. We did a study whose objective was to document the experiences of those who are implementing care for child development in Kenya, Uganda, and Tanzania, and also to pick out best practices as well as recommend policies that can be used to enhance development outcomes of young children. So this study was descriptive. We interviewed mostly program staff, but also government officials who are involved in the implementation of CCD, as well as other partners. So master trainers for the care for child development. They are the ones that conduct the training through a cascade model, where they train others to train others. And ultimately, the implementation is most times through community health volunteers. And we have some similarity within the three countries that we examined in terms of the use of the community health strategy. And so we interviewed 21 participants, and we analyzed thematically. In Kenya, we interviewed the Madrasa Early Childhood Program, whose implementation has been in rural Kilifi. In Tanzania, we looked at the Madrasa program in Zanzibar, as well as the Elizabeth Glaser Pediatric Foundation, EGPAF, which has implemented in mainland Tanzania, as well as the Aga Khan Foundation, also in mainland Tanzania. In Uganda, we looked at the Madrasa program as well, but we also looked at what government officials have been doing in this regard. So the focus area was looking at implementation in rural contexts, looking at implementation through a partnership between civil society organizations in Tanzania, and looking at implementation that is government-led in Uganda. We looked at what different ministries have been able to do. We also looked at Save the Children because they have been implementing CCD, but also because they have then built from there to develop the Boost for the Youngest program, which has advanced the care for child development implementation through incorporating aspects such as looking at adolescent pregnancies and supporting caregivers who are the young caregivers. So the results from this, first, the success factors were what drove the successful implementation for the care for child development. First was leveraging on existing systems, and primarily that's the community health strategy. In Uganda, the village health teams were the ones that did the implementation at the community level. In Kilifi, it was in Kenya, the community health workers, and in Tanzania, it was as well the community health workers. And then the other success factor was use of a multi-sectoral stakeholder collaboration team. So we've seen in all three countries that they have all managed to develop a multi-sectoral technical working group in one way or another. In Kenya, it's led by the Ministry of Health. In Uganda, it's led by the Line Ministry for Gender and Social Welfare. as well as in Tanzania. And Tanzania recently managed to develop the national multi-sectoral ECCED program, which is a big deal because it's been documented, like it gives a legal framework for the multi-sectoral collaboration. So it's possible that this can be achieved. And then the other factor was the use of innovative methods. And this was through sending SMSs or text messages to caregivers, because traditionally the delivery has been face-to-face through community health volunteers, but the use of SMS messaging, the use of radio platform, and the use of video. Video was particularly popular with the male caregivers. I don't know for what reason, but it was the most used among the males. So use of different platforms to access the caregivers was a winning factor, as well as integration into government programs. For instance, in Kenya, today we heard that it's being implemented. Care for child development indicators like the ones in the UNICEF mix in terms of looking at how the stimulation for young children is taking place has been integrated into the DHS, the Demographic Health Survey. This has also happened in Uganda, that they're now tracking data on child development. So, and then also including the CCD package in the in-service training for frontline workers. Okay, there are a number of challenges. I'll not go into them because of time, and they're also similar to what has been discussed in terms of the community health strategy in Kenya. For policy recommendations, our policy recommendations are first to ensure there's annual budgetary allocation in terms of ECD services on using a holistic perspective, expanding the access of effective and essential ECD programs, prioritizing formulation and implementation of ECD policies. The different countries are, the countries, for instance, in Kenya, the policy is in formulation, and that is expected to be concluded soon, hopefully. In Uganda, there is an integrated ECD policy, and also in Tanzania. So maybe what needs to be done is to keep an eye out to be sure to incorporate emerging evidence and context-relevant evidence. Then, of course, seeing that the multi-sectoral perspective is a strength, we need to also ensure that is done. And also, ultimately, ensure that whatever it is that we are delivering through this platform is well adapted to the contextual needs of the caregivers. So, lastly, also it's important to ensure that we keep collecting data to be able to document the process, identify the gaps, and where we need to prioritize. So with that, I'll just acknowledge our partners who supported this study, UNICEF, Lego Foundation, and the Aga Khan Foundation. Thank you very much for your listening.
Thank you very much, Joyce. I'll invite our last speaker, Millicent Yugi, who will be presenting on ECCED in Nakuru County.
Thank you. Good afternoon. I'll make a short presentation on early childhood care, education, and development in Nakuru. Nakuru County is made up of 11 sub-counties, 2 of which are purely urban and lie within the city of Nakuru. The remaining 9 sub-counties are a mixture of urban, peri-urban, and rural communities. and therefore we are a county of diversity, and whatever we do, we also look at the circumstances of the communities that our schools are situated in. And therefore, under the components of nurturing care, I would say that within the multi-sectoral approach, we started with the parents, and we say that the very first caregivers are the parents, and therefore we work closely with them to encourage them to take care of the children well and to establish school feeding programs in both public and private ECD centers. The private schools are doing quite well, but we have a bit of a challenge with the public ECD centers. We don't have school feeding program that is common to all public ECD centers. We started the program in the year 2015, but sustainability became a problem, and we still hope to convince our political leadership so that they can give us the goodwill and the funds to continue with that program, because when we did it briefly, it increased the enrollment rates within the county. We also work in partnership with non-governmental organizations to support school feeding programs, especially among most vulnerable learners in the urban areas. Urban poverty is worse than rural poverty, and children literally go hungry in the informal settlements. And we have worked with certain partners who have been able to provide such children with at least a hot meal in a day. Together with the Ministry of Health or the Department of Health, we do regular deworming programs and vitamin A supplementation that is done among all the ECD children in public schools and also in private schools. We also do a lot of awareness creation among parents on child care and child development. This is an area that we purpose to meet with parents whenever they come to school, whenever we go to barazas. We purpose, as the Department of Education, we purpose to talk about child development, because we don't assume that these parents know what needs to be done. And more so among communities where the parents are very young. I mean, we have many adolescent mothers in Nakuru. It is an issue, and I believe we have to keep on talking to these young mothers about childcare, because we have gone to places where those are the areas that are known as food baskets for Nakuru, for example. You go to a place like in Kuresoi South, Olenguruone, they grow a lot of food. They grow a lot of, they produce a lot of potatoes, a lot of vegetables and all that. They have a lot of milk. But unfortunately, when you go to schools, when you monitor what the children eat in those little packs that they are given to go with to school, that food that is produced does not translate to healthy food to these children in school. And for this reason, our stunting rate in Nakuru is a little higher than that of the national rate. We are at 27.9%, and the national rate is 26%. So we don't take it for granted that these parents know what to do. They could easily be selling eggs and milk to buy mandazi and bread for the children. Then we have developed a Nakuru County Nutrition Action Plan. This was done recently, and it is in place. It will give a roadmap to all stakeholders to address malnutrition and stunting in the county. at the school level, we emphasize the concept, the child-friendly school concept. And we want to make schools to be as friendly as possible to the children, and therefore we are guided by manuals from the Ministry of Education. We also have the school safety manual, which we actually use in our schools. We implement CBC in all our ECD centers. Nakuru embraced CBC very well, and therefore we have had our teachers being very supportive in ensuring that all the schools are implementing this program. Inclusivity in offering ECD education, it is something that we encourage a lot, and our learners who have disability, especially disability that can help them cope with other children, are encouraged to learn alongside the other normal children. We have seen, we have done a lot of programs regarding water and sanitation and hygiene, and as a result of that, we have seen behavior change after implementation of those programs in our schools, and we have continued to sensitize our teachers and non-teaching staff on COVID-19 and the necessity to keep hygiene at the school level. Together with the Ministry of Health, Public Health especially, we have periodic inspection of ECD sanitation status just to ensure that the children learn in healthy environments. And many times we end up giving notices of closure. Of course, the Ministry of Health is giving the schools notice of closure, and there we are as Department of Education, we have to do something. So you see, and I'm happy when the public health do that, and I even encourage them, if you find it bad, tell us so that we can do something about it. And we have been able to adopt new sanitation technologies. The Sato pans, these are small pans that are child-friendly. The children are not scared when they use those small pans in their latrines, and they are quite friendly. They don't have flies. They are not smelly, and the toilets are quite a good place to visit for the young children. We have not done well financially. And I would say that our major budget lines go to design and construction of new classrooms and employment of ECD teachers. As I come to an end, I just wish to mention briefly on our key achievements. We started with construction of classrooms since devolution. The situation was very bad, and so far we have done over 600 classrooms. We have engaged ECD teachers. We are not doing very well because we have over 1,000. Now there are over 1,000 schools, but we only have 372 ECD teachers. We have advertised for another 300. Continuous training of all ECD teachers on CBC and other emerging trends in ECD. We decided to also equip those classrooms with age-appropriate furniture. So far, we have reached 17,000 learners with such age-appropriate furniture. We also started a program where we are setting up centers of excellence, one in every sub-county. So far, we have done 2. These are functional ECD centers that have all the facilities that are required according to the standards that have been set by the policy in Kenya. And we have done one in Naivasha and another in Nakuru West, and we hope we will cover all the other 9 sub-counties. We are building partnerships to address children issues within the county. Then our challenges include the shortage of teachers. As I've mentioned, what we have is a drop in the ocean. We need over 2,500 teachers. We still have inadequate infrastructure and inadequate learning resources, especially for special need education. And this area is very key because the special need children are missing out on ECD, on early childhood education. Recently, we did some screening and we discovered that these children are at home because of their age and the distance to the units for special learning. They cannot make it. The parents cannot make it. They cannot board in those schools. They're still too young. And the schools around them don't have any programs that can address their special needs. So that is an area that is a big challenge. Of course, weak parental involvement in resource mobilization for school development. Parents at ECD level are not willing even to do a pit latrine for their children. They've left it. They've raised their hands and they say that is for the county. Yet it is their children who are suffering when the county has not allocated any funds to do that. Then unfriendly school environment due to dilapidated physical facilities. And of course, inadequate supervision and monitoring of ECD curriculum. Low budgetary allocation is a big challenge. We are still not offering free ECD education, though it is a constitutional requirement, but we are not offering free ECD education. We don't have the funds to do so. Priority areas in the next 1 year, we want to continue to put up new classrooms and wash facilities. We want to equip the existing classrooms, so we will continue with what we had started, and we want to provide instructional materials, what the learners use in class, the books, the charts, everything that they need for learning, quality learning to take place. Provision of employment of ECD teachers, we will continue with that. And of course, we want to engage with stakeholders and other partners more so that we can achieve more in our early childhood education and development. Of course, capacity building of teachers and staff on emerging ECD issues will still be our priority. Thank you so much for listening to me.
Thank you very much, Millicent. Let us appreciate the speakers once more. We've done a good job of keeping within the time. I'll request the usher assisting us with sanitizing and taking this round to help. I'll do a quick recap of what we've had. Very rich conversations from the panelists. We've basically covered the nurturing care framework in this panel. We've had conversations around play, how the Madrasa Early program is innovating play using available materials and even using the digital platforms like SMS to make sure that play is implemented with the resources available. We've heard about maternal stimulation and the way it affects the 5 areas of early childhood development, the language, the cognitive, and the motor skills. We've heard on health and how the integrated management of newborn, the different milestones that have been made, that we now need to move away from the conversation around immunization because we are doing well, but there are significant gaps on the on MWAC, on oxygen saturation measures, which are routine activities that should happen when children go to the healthcare facilities. So basically just talking about the pediatric quality assessment gaps from the health office, from the health angle. We've also heard about care for child development and the implementation in the 3 East African countries, how policymakers or how linking with policymakers can ensure that some of these interventions reach out to all children within countries, and that the solutions are very easy and implementable. Lastly, we've heard from the Director of Education from Nakuru County, and I had a concern from my table that our county is presenting. We wanted to hear from different counties, which you'll hear over the next 2 days, a few counties talking about what is happening. And she's talked about education, she's talked about nutrition, and she's talked about sanitation. Talking about the infrastructural gaps that were there, how they have met that, and the gaps that still manifest on that in Nakuru County, including the issue of stunting and adolescent mothers. So very insightful conversations that really tell us where we are at, the gains we have made so far as implementers, as researchers, and as the government at the subnational level. So at this point, I'd like to invite questions from the audience. And so the mic will be passed around. I'd like people to raise their hands. So we'll take 2 or 3 set of questions, and then we'll be able to close. Any insights, additions, or questions to the panelists? There's a hand there.
Thank you so much, our panelists and everyone that is represented here. My name is Bella Owuor, working with KMET, based in Kisumu. My only concern throughout these sessions is basing that on the presentation by Nakuru County, because we are looking at nurturing care being a co-function at the county level. But then the key concern that is coming out is there's the issue around resource allocation still being a challenge, the issues around the ring-fencing aspects of the budgetary allocations in regard to early child development still being a problem. So we are wondering as partners, as we sit here, that the key focus of the county should not be looking at the development, the partners or developmental partners to come in and support. What is it that we can do better as counties to ensure that the ECCED aspects are being budgeted for and also implemented at the county, regardless of also the policies that are there that needs to support the implementation? Thank you.
Thank you. My name is Petronella. Petronella is from NMS, Nairobi County School Health Program. Looking at also the nurturing care and issue of the teen mothers, I was looking at a sustainable way of having, or rather ensuring that also the mothers, the teen mothers, are also beneficiaries of the same, considering these teen mothers, some are in school. And as a program, school health program in Nairobi, we have the school nurses who go to the various schools. And in one of the sub-counties, I know we have about 300 teens. And so mine is a proposal, if in the framework we could also consider training of these nurses, or rather the school health officers, who will continually be giving, or rather supporting the teen mothers. And I liked the presentation from Kilifi, the provision of My Brain Power Pack. Is it something that can also be considered as we train these officers also to have the same and continually help the teen mothers with that support?
Thank you.
Oh, thank you very much. I'm Dr. Lutomia George, CECED Education Kakamega. My concern is with the madrasa. And on madrasa, I wanted to inquire and also maybe look at it that it's good that Agahan Foundation, Agahan is looking at it. And I want to look at DUXI. We had recommended earlier on that DUXI education should also involve some mathematics and geography. Are you moving ahead to assist, see how it can be implemented other than just traditional religious education? Thank you.
Good evening, everyone. My name is Alice Kibwe. I work for SOS Students Villages, Kenya. And coming from an organization that is focused on developing children and youth, my concern is what is happening in the counties, and I take special interest in just looking at what is happening down there, even in our ECD centers, even in places where the organization does not reach. And one of the observations that maybe I would bring out in this forum so that the counties represented here would take interest in is a presentation has been made on Nakuru County, and we congratulate the county for having centers of excellence. But one question that I would like to ask is who is benefiting from these centers of excellence? Because we need to really be deliberate on looking at the ECD centers that are coming up, in churches, individual ECD centers, who are teaching in these ECD centers. And if you take interest in your village, to just look at these ECD centers and I would call them caretakers because they are not actually teachers. And we know that from a policy point of view, TSC is keen that everyone who is teaching these children should be TSC registered, and that would mean that they are qualified. But let us take interest in those uko mashinani, the village ECD centers, the individual-owned ECD centers, the church ECD centers. Who are the people who are teaching these children? Because all these children are our children, and every child has the right for equal chances. So it is important that even as we talk about maybe what we've done in counties, to really be deliberate in mapping out the ECD centers that exist and looking at the qualifications of those teachers, so that as we capacity build the ones that are known, we also capacity build the teachers in those rural areas. Thank you.
Thank you. We will take those questions first, and I believe the county has a number of questions to address. On the teen mothers, can a similar model by the madrasa be applied there? And the question on all children matter, including the ones who are in the informal kind of arrangements. So we'd like to hear from the panelists, maybe from each panelist, how they think the different methods or findings they have gotten can be applied to all children, regardless of where they are. So we'll start with Millicent.
Let me just say that on the issue of resource allocation and what we can do better to get funding at ECD, one of the things that we can do better at the county level is to stick to our lane. Stick to our lane. The county, the constitution is clear on our mandate. It is so clear on what we need to work on. Yet a lot of funds, a lot of resources are also channeled to other areas which are called education, but it is not our mandate. When you put so much funds into bursary is not our mandate, and bursary is offered at other different levels. And we are concerned that even at those other different levels, there is no proper structure to know which child has been supported by the county, by the CDF, National Government CDF, or by the Office of the Woman Rep, or by any other office or any other NGO out there. There is no coordinating office at the county level. So I believe if those funds that go to bursary would be freed to come to ECD, it would give us a lot of push in our endeavor to give quality care. On the issue of centers of excellence, the centers of excellence were strategically supposed or put in areas where the communities or there was dense population, and one of the qualifications of an area to benefit from this project was the number of children that attend that particular school, because we put them in specific schools. And the numbers had to be above 200. The beneficiaries are the communities where those schools are placed, and the county in general, because when other schools within that sub-county come to that school as a center of excellence to see what the ideal ECD center should look like, then it is a learning point. Centers of excellence are learning points, and we hope that that in itself should ignite those that are in charge of fund allocation to also allocate funds to ensure that we have other mini centers of excellence within that given sub-county. The qualification of ECD teachers is very clear. We now have a scheme of service that we are implementing. The law is very clear that every teacher must be registered by the Teachers Service Commission. And as we do our work, we supervise to ensure that the teachers who teach, even in those village schools that are very far away, both public and private, are trained teachers and qualified teachers. However, there are pockets of places that do not have enough trained teachers. And in those areas, the people who are in charge of those ECD centers may be untrained. And when we spot them, we encourage those teachers to register for training. Unfortunately, right now, where we are going, we may not have school-based in-service training. We may have only training at the colleges. But earlier on, the system allowed these teachers to train as they taught in these schools. And when we have any trainings, any short courses, we involve these teachers to build their capacities, even though they may not have the basic teacher education certificate. Of course, there are some of them that may not qualify for direct entry into the teaching or teacher training colleges. And we are training them in very few areas. Those very remote areas is where we have shortages. And the teachers come from those communities. It is difficult. But what we are doing as a county, we are now employing teachers, and we are giving teachers to all areas, including those very remote areas, we are now giving them teachers. And of course, we are employing qualified teachers. Thank you so much.
Thank you very much. So I'll quickly ask each panelist to take a minute to just tell us, based on the work they've presented today, what do they think can be done for all children, especially those who are vulnerable in and are not able to access those services.
Okay. Thank you very much, Ruth. From the responses from the members, for the responses of comments raised by members, there are two questions, or two comments rather, for Madrasa to respond to before I get to what we think we can be able to do as a team for all children. So one is about my brain power pack, and thank you very much for picking up on this one. We actually managed to do this through resource mobilization from communities from Kenya, through an online platform, managed to get resources and did power packs as gifts for families in Kilifi and Kisii counties. And we hope to do more along that line, especially towards the end of the years. For Duxi comment, I would like to kindly request my regional ECD advisor, Aga Khan Foundation, who happens to be in the room this afternoon, to actually respond to that. Thank you. Maybe I could finish up in terms of what we can do. Sorry, Amina. Maybe I could finish up on that one. And for me, what I think, and following on the presentation that was shared by the Ministry of Health early afternoon today, I picked on the various priority areas that the ministry has actually lined up in as far as what we can do as a country around reaching out to all children. I like particularly the fact that they have highlighted integration of some of these best practices into trainings for our healthcare force, which is something that will translate into high-level results as we move forward. Thank you.
Thanks, Marsad, and thanks, Bona CEC. Very briefly, what I want to mention is that the Madrasa Early Childhood Program has a history where it used to serve the Muslim communities, and that was about 20 years ago. But since devolution, we have gone beyond serving just the Muslim communities, because we realize that there are others within the communities that also need early childhood program. So currently, the program is actively partnering with the county governments in Coast Region, in Western Region, Nyanza, particularly Kisumu and Kisii, to deliver early childhood intervention within the public spaces. Yes, we do from time to time provide technical assistance to the madrasas on request from their end, and mainly to do with methodology, where we really stress on the play-based methodology being integrated and the removal of corporal punishment in those madrasas. So I'm happy to have this conversation with you maybe later to give you some details on how best maybe, just to reflect on some of the issues you have and see how best maybe we can continue to support them. Thank you.
So I think I'll briefly touch on the issue that was raised about what we can do for teen mothers, and also for caregivers who are taking care of children with disabilities. So in terms of the Care for Child Development package, there are the modifications that have been made to this package, drawing on lessons from Uganda, and through the Boost for the Youngest program, is that they've carved out a niche. So usually, for instance, with the Care for Child Development delivery within group settings, you find that if there are very young mothers, teenage mothers, they'll not show up to community group meetings. So it's to just be sensitive to those categories of caregivers, to know that they have, their interests might be the same for the children, in terms of what they want to offer their children, but they might not feel comfortable being in a mainstream mothers group, for instance. So in terms of being responsive to these specific needs, the Boost for the Youngest program, which has built on the Care for Child Development, has put in specific measures and guidelines in terms of how to engage young mothers, and also bearing in mind that the children of these young mothers are at more risk of failing to meet their developmental milestones. So in terms of that, there is the Boost for the Youngest has also integrated some additional material to address the needs of caregivers who are taking care of children with special needs. So the package itself, it's basic, but there is room to integrate additional components which respond to contextual needs that are relevant to the county or region in which one is operating. So in terms of what you can do for children, I believe that as a nation we're doing a lot. We're doing something with regard to interventions for children and caregivers. So there is still more that needs to be done. What we need to do is probably look at the data, identify existing gaps, and it's good that we've, through this session, we also, and the counties are also presenting data on where the target areas are, and that is quite enlightening. So I think that we just need to identify those specific areas and then use existing resources. There have also been very good insights in terms of how we can make best use of resources that we have and not purely rely on international partners to finance this, that the counties have the ability to do this. Thank you very much.
Thank you. I have a thinking, and this is a conversation that we have been having in the past few weeks. Since morning, or since we started, we have had a lot of policy recommendations, and some of them are focusing on the government, the county government and national government to take action. And one thing I want to say is that we really need to move from policy recommendations to policy implementation, because that is the only thing that will help our children. We might have as many recommendations as possible. If we don't do anything after we have finished this conference, then the whole investment that was made here will go in vain, and the status of our children will remain the way they are. One thing I want to suggest is we think of multi-sectoral, and with intergovernmental agencies, we come together now and say, yeah, here we have enough policy recommendations, we have enough. Now, let's focus on getting to the implementation of these policies. Because if we just talk and continue talk, like an organization, as an organization, we have a lot of data, we have a lot of evidence. If you go to each of these breakout rooms, you will find at least you are making 1 or 2 or 3 presentations there. But the question we are asking ourselves, what next? We have evidence now. We have given them out in terms of dissemination, like in such conferences. But what next now? So then the next thing is thinking about policy, from policy to practice, so that we can also help our children. Otherwise, every year, every month, every quarter of the year, we'll be convening, we'll be having such expensive conferences, and at the end of the day, we go with, it was good, and then we keep everything we had in the shelf, and we continue like that. And we continue saying here, continue reporting that evidence shows that children from sub-Saharan Africa are at risk of not achieving their developmental potentials. They are at risk of poor development. They are at risk of what, all those things we are saying. But the question is, what are we doing about this? We have a lot of pockets, let me call them pockets, implementations across the country. Is it possible that all this can come together? And we say, yes, we are doing this here, we are doing this here. Is there a way we can partner with the national government? Is there a way we can partner with the county government? Is there a way we can get into the ground and ensure that we implement this policy, these recommendations that we have given here? And that is one thing that I have today. Thank you.
I think most has been said, but what I want to mention is we are here, many sectors. We've heard from education, we've heard from health, and even others. But one question we would ask ourselves, where is the coordination of all this? At the county level, who is coordinating all these departments or sectors? At the national level, so my recommendation is, can we have a structured coordination mechanism in matters related to children, because that is not very, very strong, both national and county level. Thank you.
Thank you very much. We'd like to close. It's been a long day, so we'd like us to close at the top of the hour. So before I do that, I'd like to hear any final remarks. I think we've closed with the questions to the panel. So we'd like to hear maybe 3 participants. What is their takeaway, or what do they think they can contribute to the conversations as it relates to nurturing care framework?
Good evening, team. My name is Paul Otwate. I work with Aga Khan University, IHD department. I just have a follow-up and maybe possible recommendation. First of all is just to appreciate our team members, presenters, for sharing very useful information and findings that I see they are going to be a shape or a new light to the child. Meanwhile, I'm just suggesting that if there is a way that we can really, as a team, maybe by the end of tomorrow, which will be the end of the session, we can come up with a hub of getting all this information documented in a very structured way, and possibly establish a coordination team that is going to do a follow-up of this so that all these investments can be realized. Otherwise, thank you.
Thank you, Tim. It's been a learning for all of us, and thank you for some of the responses that came in. A key take-home for all of us is just to be able to focus on the child, and looking at our usual slogan of the bottom-up approach. So let's focus on the child, and let us have strategies to ensure that the child is taken care of. I know there have been some recommendations in regard to multi-sectoral approach that we need to look into following up this conference. And then one of the key things that also came up is a coordinated action. How do we coordinate all these processes following up this conference? And then having targeted and focused resource allocation that is also going to help us support these children. So let us not come out of here empty-handed, but let us go back there na tupige debe watoto wasaidike. Asanteni.
Thank you very much. Mine is first to appreciate the presenters for the different perspectives, and particularly to appreciate the county governments for the work they are doing. We know the competing priorities that are there. You know, it's not just about ECD, but the others are as well. But really to appreciate what you have been able to do and some of the plans that you have moving forward. Just speaking from a comment from my colleague here around bottom up, but also to ask ourselves how best can we be able to respond and to provide feedback to some of the policies that are coming from the national government that have implications on how we implement ECD at county level and grassroots level. And just speaking from the colleague from Nakuru County around the qualification of teachers, right now we know that the ministry has new qualifications for teachers who want to enter the profession for the first time, a C grade, you know, which competes with others like nursing and engineering and so on. It's good to have those academic qualifications, but let's not forget about those competencies that are so critical, you know, in early childhood. Let's ask ourselves, what makes a good, maybe ECD teacher? What are those knowledge, skills, and attitude? You know, the heart, hands, and the head. Head for the knowledge, heart for the attitudes, and hands for the skills that they need in ECD. It's not just about the knowledge. So how do we, as practitioners who are down there in the counties, in the field, able to influence some of these decisions that are being made at national level that we know have long-term implications into the sector? Thank you.
Thank you. I want to emphasize on coordination, and I want to thank Nakuru County, because when the presenter started, I could not tell whether she is from health or education. She covered what the health is doing and what education is doing, and that means the county, the two departments are working as a team. The other thing, when I think this presenter from the Ministry of Health was presenting, she told us that the ministry is preparing the policy for 0 to 3 years. And I did not mention that we are preparing the policy together with the educations. So I think, because we are dealing with the same child, we have to work as a team, and there must be a coordination at the county level and the national level, because we are dealing with the same child, so that we don't say that healthy we are doing this, and we don't know even what the education scientist is doing. So it's important we work as a team because we are dealing with the same child.
Anyone who, thank you. I think we will close with that comment.
Thank you. My name is Elena Wangui from World Vision. I want to support that it's the high time we focus on the implementation of the policies, because all along we have been talking about the policy gaps. I think like currently, or previously, we had the Early Childhood Education Act 2021. These are recent act of parliament, and most of the counties are not maybe implementing the recommendation or some of the that have been articulated in that Education Act. So issues of qualities in the ECD centers, issues of teacher training, all those issues have been articulated very well in the Early Childhood Education Act. So it's the high time we go back and start doing what is right to save the Kenyan child. So thank you very much.
Thank you very, very much for your patience, for the contributions. I'd really like to thank the panelists, Millicent, Joyce, Rose, Silas, and Masad. Thank you very much for the insights you've given us today and to the audience. I believe we leave here with some keywords that have been repeated throughout the conversations. Coordination, implementation. Let's work together because every child matters. Not one child should be left behind. So thank you very much. We'll continue having this conversation And we continue engaging more tomorrow. And even after this, you could reach out to the panelists and you could have this conversation among us. So you're welcome to have tea and leave at your own pleasure. Thank you.
So what happens when people expose this child to vulgar language, to nudity, to, these other things? The child is not protected, right? So this is that child. And I think this is where now we come. So let me just continue so that after this, I will cite very quick what needs to be done. So this is a child who could be experiencing unstable psychological conditions owing to the traumas experienced during arrest. You know that some of these children during arrest, this is the arrest scene. There is blood, there is violence, there is all that. Some of them end at the National Rescue Center in Kabete, Lower Kabete. Some accompany their mothers to prison. This mother is frightened, is in agony, is in regret, is in pain. But still, this child is exposed to all that. So what are we saying? That child needs counseling. Sawa sawa. So we will see. Do they get counseling, child therapy? So then there's sudden change of environment. In prison, because I've worked there, at some point my office was inside the prison, and sometimes, that's why when I'm working with the prison, they are like my family. So in prison, there's the prison protocols. So that child is exposed to the prison protocols. Saa kukaba, mama anakaba. That child is conditioned psychologically, and they know there's this thing of kaba, you squat, so that you're counted. Sindio? The opening and banging of doors, esabu, tokeni, mkule, Sindio? When a mother or somebody is being punished, the child is exposed to all that. When an adult is being, caning is, these days prison, people are not beaten. But, for instance, some sort of violence. See, that child is exposed to all that. So that is that child. So these children, by virtue of all this, they're exposed to an environment where they are afraid. Sometimes they worry, and sometimes they get stressed. They get stressed, why? In as much as we have the daycare centers, there's a gap now. We need to establish a way that this child goes through, and I will bring out that in recommendations. There's a systematic program for these children. Play therapy, care, counseling, yeah? So I'm being told, I'm running out of time, but I've tried. So there is need for that the child needs to be, currently I've said that there's a policy framework that is being developed. Within the policy framework, we have cited that there is need for different things that I will recommend, because now I have to finish. But I think I've cited the problem. Just go. That is the Prison Act, I think. Just go up. Yeah, so overall, at one go, because there are these children who come into the remand and they go with their parents, they are released. But there are those who stay during custody. So the data are usually not very clear. And when we're talking about data, we're not talking about numbers. We are talking about at what age did the mother get into prison with this child? What was the nature? What even, real data. But at one go annually, and the number of children that go in and out of prison is 200 plus. So they can go up to 1,000. So what about 1 year? So what about 1 year? So what about 5 years? So you can see some of them are the children we have today. The youths who are, most of them, suicidal and disturbed. Some of them, if you follow their stories, they're children who are born in prison, but nobody ever talks about them. So just go up. I've mentioned about the issue of the risk. I've mentioned that. Just go up. I think I've mentioned that. Yeah, so just go up. Yeah. So, and I've also mentioned about the effects. I think I just put this presentation together. So our intervention as Faraja, we came in and we ensured that there was a daycare in the maximum prison. And then we also established one in Embu prison where there was a very dire need. So coupled with that, we have ensured that these children have access to a child-friendly environment. They have access to toys and sanitation. But you see, the daycares only cater for the daytime care and nurturing. So what about the caregivers? Are they trained? So there are so many gaps, and I know these gaps will come out as questions. So I might be able to respond to some of these gaps. But what now we are recommending nationally, those recommendations, I summed them up into 3 main recommendations: that prisons, through care management policy guideline procedures, to strengthen the aspect of reintegration, child diversion, and handle the issue of pre-care of the children, the nurturing, the play therapy, psychological, and aftercare aspects of that child. During separation, when that child is separated from the mother, there is trauma again. Leave alone now the first trauma. This is the second trauma. It's like, well, if the mother is staying in prison for 20 years, it's like mother is dead temporarily. So this child is connected to a relative. You're my relative, I don't know you. You don't know me. That relationship was never established. And that's why we recommend a through care guideline policy within the policy that is being developed right now. So that these children, their separation issues, counseling and bonding with the people who are taking them is catered for, safety, upkeeping, education of those children. We recommend a structuring of an M&E policy framework to strengthen the safety, tracking, and aftercare that will follow up and capture data so that we know where the gaps are. So that is a recommendation at national level. And then the last one is provision of budgetary allocation by the government so that these children are also supported well within the prison mandate in coordination and collaboratively with stakeholders and is guided in the policy procedures to handle care, nurturing, and parenting, matters to do with parenting skills. Now, as parting shot, I would say most of us here will talk about children matters and we are representing the children. Can we also include the mothers? In as much as we are doing this for children, what are we doing with the mother? Whether it is a disabled child, whether it is a child going through migration, what are you doing to that mother? Because if we can do proper parenting skills to the mothers, most of these things will be sorted out. Handle the psychological wellness so that children will not die and will be safe. We know very well parents are also killing their children. So by virtue of that, they become our clients in prison. Thank you very much.
Thank you so much, Christine. A round of applause for Christine. Asante sana for that candid presentation. So please remember to note down your questions or concerns and we'll address them after these presentations. So we will move on to our second presenter, and that is Jane Wesonga. So Jane Wesonga, your 10 minutes begin now. Can we have Jane Wesonga's presentation up, please? Okay.
Good afternoon. My name is Jen. Oh, sorry. Good afternoon. My name is Jen Wesonga. And as you can see from your screen, I'll be presenting a paper titled Incorporating ECCED in Daycare Centers within TVETs in Informal Settlements to allow safety and better child development as young mothers access education and skills. So we'll move to the purpose of this, the main aim of this paper. We wanted to propose policy reforms to enhance better child development and safety for vulnerable children in informal settlements when their parents have decided to go back to school with a special focus in the TVETs. Those are the technical vocational training centers. So our problem statement, as you can see, is that the children in informal settlements, they face various challenges from safety to health due to several factors like poverty and nutrition. And so this situation is further aggravated when their parents decide to go back to TVET, specifically their mothers, and they have to leave their children at home. Please remember that this is already an informal settlement. Let's take, for example, the slums. So there, the life of this child is already in danger. So imagine when the mother has to leave this child in the care of other people to go to school. Imagine what does that to that child. So the main question that we are addressing in this abstract is, how do we influence policies to ensure that the children, there is meaningful inclusion of children in special circumstances, especially in the informal settlements. Then we are also looking at possible funding mechanisms to support setup of ECCED centers and daycare centers within TVETs in informal settlements. Then we are looking what are the partnerships and coordination frameworks that develop and the ones that we can develop so that we support this initiative. Next slide. So we analyzed these, we went through this abstract using different reviews. So we did desktop reviews of existing policies. We looked at existing policies like the return to school policies. We looked at the SDGs, Vision 2030, ICPD 25. And we realized that through these policies, there seems to be a gap in such a way that children who are kind of like marginalized, children in informal settlements are marginalized in such a way that they are not getting the quality of education and ECDE that they need to when they are at that young age. Hence, we decided that to propose that it will be good if daycare centers are set up in TVETs so that as their parents go back to school, the children are also able to be nurtured. And then point number 2 is the consultative stakeholder workshops and review with young mothers. So in our line of work as OAY, we work with teenage mothers here in Nairobi and in Kisumu. And when we interviewed most of those mothers, when we were doing this paper, we asked them, most of them are willing to go back to school to study, but the challenge that they are facing is their children. Who is going to take care of their children? How are they going to breastfeed their children when they go back to school? Which definitely, when you think about all these things, it definitely affects the development of those children. Then the third point, we looked at a project that we are analyzing. And we're having engaged mothers in informal settlements. As I've said, their interest to further their education poses a challenge to their children, their child safety, and they'll not be able to breastfeed their children. Infection prevention and COVID-19 infections and inadequate support system when they leave their children at home. Next. So out of those 3 areas, our findings were that there is definitely a gap in the informal settlements when it comes to implementing of the ECDE. You realize that in the informal settlements, there are all these issues about safety and security, poor infrastructure, congested classroom, and unfenced school compounds, which definitely will pose a risk to those children. So we realized that through consultative meetings with those teenage mothers, most of the mothers want to join TVETs, and we did this in conjunction. We work with a TVET in Dandora. It's called Green Light TVET, and we realized that in that TVET, more enrollment are for the boys. There are less girls who are enrolling in TVETs after they get pregnant. And when we try to inquire why, most of those mothers, they didn't know what to do with their children when they go back to school. Hence, we felt this is the need why we need to come up with policies which allow TVETs to be able to have daycare centers, so that in as much as these girls are going back to school to study, they also have an opportunity to bond with their children, they are able to breastfeed their children, they are able to protect their children, which definitely enhances better growth of their children. So the recommendations that we came up with is that there should be revision of policy to set up ECCDE and daycare centers in TVETs. And then we also felt like county governments and TVETs should recognize and invest in ECCDs and daycare centers in TVETs. Then when we looked at funding and sustainability of how we want to do it, the how are we going to fund? We figured, like us currently OAY, we are working with various TVETs. So we figured the TVETs can work with various NGOs, corporate organizations, for example, through their corporate social responsibilities, example Safaricom and Kenya Breweries. And then also through county government funding, we can be able to fund and sustain the daycare centers within TVETs. Then we also looked in terms of partnerships, like how, if we set up those daycare centers in TVETs, how are we going to support them? And we were like, through working with the Ministry of Health, things like immunization, being taught about nutrition of their children. That will be able to sustain those daycare centers, and those mothers will feel that their children are being well taken care of, even as they go back to school. Thank you.
Thank you so much. I was just about to remind you of your time. Thank you for managing your time quite well. Asante sana. So then we move straight to our third presenter. Anil, please take the floor.
Good afternoon, everybody. We're talking about children in prison, of mothers who are criminals. Why would we want to educate them? Can I have some feedback from anybody? Why would we educate these children? Dr. Abdullah, why educate these children? Because you don't want them to repeat the cycle. Okay, why else? They're not prisoners. Okay? Yes, sir. You want to give them hope. And if I tell you that is a waste of time, what would you say? Huh? It's just right. Forget it. Yeah? Leave it. But, I mean, why do we really want to bother? We can't even reach the children that we need to reach. Why now do we want to reach children that we don't want to reach? Where is my good friend? She's not here. She talked about special education needs, Sheila, from the Ministry of Education. Right, let's have the slides, my friend. Come on. Yeah. Let's go to the next slide. And the next slide. Right, and the next slide. Right. So, we're in trouble. Basically, we're in big, big trouble. Now, I'm not going to read all of that. You can read it. But Bill Gates, you know Bill Gates, yeah? The richest person in the world a few years ago, no longer richest. The Bill and Melinda Gates Foundation is the largest foundation in the world, worth $500 billion, larger than all other foundations put together in the world. What is Bill Gates' #1 priority? To educate all children all over the world, regardless of their circumstances. Why? Because the world is in trouble. Climate change, pollution, urbanization, inequalities, youth bulge, lack of hope, war, inequality. So he says that we need people who are of genius level capacity. I'm talking about Einstein. I'm talking about Ngungi. I'm talking about, you know, people like, who was the father of Pan-Africanism in Ghana? Yeah? Who led the independence movement? African history. All right. Right, you know who I mean. Yes? We need people of genius level capacity, otherwise we are not going to move towards a transformation that we need. Where these genius people are going to come from, we have no idea. It could be a prisoner who is being born today. It could be a child who is on the border of Somalia in Dadaab or Kakuma. It could be a child in Nairobi primary school. It could be anywhere. So we need to put education. Now there's a huge conceptual framework. Next slide, please. There's a huge conceptual framework behind this. Everybody's talked about equity and, you know, rights and the rest of it. But the conceptual framework basically is that if we collaborate rather than compete, we will move towards the transformation that we want in our society. If we continue to compete for resources, we will kill each other more than if we will survive. And this is what we are seeing now in Russia and Ukraine. We are seeing this in Kashmir. We're seeing this in Palestine. We're seeing this in northern Uganda. We're seeing it in Congo. Yes, competition is not getting us through there. I'm not going to go through it too much, but we are facing a knowledge society transformation with artificial intelligence, with machine learning, with automation. It is now estimated that 40% of jobs were lost during COVID to automation. Those jobs are not coming back, which means that we need a transformation based on education as not only a right, but in a new way to do this. So the approach that we want to take at the Aga Khan University is that we are seeing rising numbers of children in prison. And the statistics are formal statistics. Let's move to the next slide. So, yes, children are unjust victims. Yes, they're not being rehabilitated. Yes, you know, babies that are in prison are more likely to be radicalized, enter into violence, perpetuate the cycle, etc. Let's move on. ECCED is not getting the space. Let's move on. So, we now know, we've heard about it, the brain is developing at an incredible pace in utero as well as in the first 2 years. So we now have the science. We know what good ECD does. Regardless of your circumstances, if you give good caregiving to the children and their caregivers, the outcomes are improved regardless of your circumstance. And the second point is that this is the responsibility of the workforce, whether that is in prison, whether that is in school, whether that is in the Ministry of Health. Let's move on, please. Next slide. So, the plight of children is all of our collective responsibility, but I put it to you that if we use good educational principles, which is based on adult learning principles, which is the work known as andragogy or andragogy from Malcolm Knowles, if we use learners' needs and build agency, we've heard all the policies that are there. We've heard about all the systems that are there. We've heard about all the processes that are there. We need to enliven those. That means we empower people with knowledge and skills. And the final point is that, yes, we can do facilitation, we can do follow-up, we can do future-proofing, but we have to find champions in the system. If we don't find champions in the system and we don't design programs in a people-centric design thinking approach, then we can give up, because that means we are just spinning our wheels. I'm going to stop there in the interest of time. I've taken less than my 10 minutes, so I expect a lot of questions from you. Thank you very much.
Thank you so much, Dr. Anil. A round of applause for Dr. Ari. Asante sana. Okay, so, and again, thank you to all our presenters.
Welcome to this session, and we welcome our first presenter, Margaret Lampija. Welcome on stage. The first presentation is from HLC.
Good afternoon again. Yeah, I'm presenting on behalf of our team. I'm Dr. Margaret Lampija. I work with HRC as a research scientist, and with our team from the University of York in the audience. Our title of our work is Improving the Quality of Child Care Centers in Nairobi, Informal Settlements through Supportive Assessment and communities of practice using the existing government systems. In short, you can call this the community of practice study. Next slide. Yeah, just a quick background because I only have 10 minutes to tell you what we found or what we are going on with, is that informal settlements have sprung up really rapidly in the informal settlements, in the informal urban settlements or the urban poor settlements in Nairobi. And this is as a result of the growing demand for child care as more women engage in paid work. And however, we have found that, or we know that child care center providers running these centers have little or no training, and the facilities are really below standard, putting the children within these centers at risk of poor health and development. So our aim was to develop, to co-design and test the feasibility of communities, our community of practice model, where trained community health volunteers or CHVs provide supportive assessment and group sessions to improve practices of childcare within the informal daycare centers. So specifically, we went out to map and profile the quality of childcare centers in the two informal settlements that we worked within, that is Korogocho and Biwanani. And secondly, we aim to co-design a supportive supervision and skills building intervention using a community of practice principle. I'll explain this shortly. And that can be sustainably delivered within the government systems, health systems. So thirdly, we also aim to assess how and in what ways and at what cost this model or intervention can improve the skills of child care to provide quality care to the children. And fourthly, we also wanted to identify facilitators and barriers facing child care providers in using these skills and improving their centers in practice and explore appropriateness and potential for scaling up. So, some words got lost about, but how did we do it, or methods? What? Please, next slide. Yes. So how did we do this? This was a feasibility sequential methods, mixed methods design study. I already said within Korogocho and Biwanani. I guess we are all familiar with those two locations. Yeah, where we initially went out to map or to identify all the daycare centers within these two locations. Then we did our basic profiling, or just a basic check of the quality and characteristics of these daycare centers. And then this was followed by co-designing. We did the basic profiling to still inform the number of daycare centers within these locations and what exactly they are like. From that, we worked with the different teams from the Nairobi Metropolitan Service or the county, and the sub-county teams, including the community health assistants, the CHVs, childcare providers, as well as parents in the two locations to co-design the intervention based on what we had, of course, read from the literature and what we had so far found from discussions with the different stakeholders. And that's how we managed to come up with an intervention. And then after developing or co-designing or drafting our intervention, we then conducted a baseline assessment, a proper baseline assessment of the 64 daycare centers where I wanted to implement it. And that also included measuring the quality within the centers, the quality of the environment, as well as the skills, the attitudes and practices and knowledge of the center providers, as well as the CAP for the CHV that were meant to support these center providers. So we also, like I said, this was a mixed methods approach where we also had qualitative interviews to still understand the issues that were emerging, especially with regards to quality and also how this intervention will work best within, this setting. Yeah, and on the side, we're also reviewing the policies, the current policies on childcare and ECD within Nairobi and within the entire country to still understand the gaps or to also get more information on what exactly is supposed to be with regards to quality of childcare centers in this setting. Next. Yes, and what did we find? Sorry, my slides have been cut. I don't know why. But from the baseline assessments, we found that home-based center providers were unsupported. As you see, pointer. Yes. We have 4 types of centers. Could you just move it down?
Down.
This slide, just reduce the size of it so that we can see the top of the table. Okay, I'll go on. So what you see in the table, the columns, we are looking at the characteristics or the profiling of the daycare centers, and we grouped them using a typology. The home-based daycare centers, which are housed within someone's, homestead or household. The faith-based, which are attached or supported by maybe church, mosque, by a faith, organization. And the center-based, those who are standalone, who are not in the home, they are not attached to a church. And those were the 3 categories. And what you see, the last one is the overall. Yes. I'm struggling to read my slides because of technical issues here. But what we found was based on these characteristics, and what stood out most is that across the 3 types of centers, there was limited or no support external support from either government or from the private NGOs supports into these daycare centers. So you open up a daycare center, you're expected to provide quality, but they were using their own limited resources. And we know that in the informal settlements, there is extreme poverty. So this was a point, really an issue that stood out. As you see, for the home-based centers, only 9%, only 4 out of the 45 centers that we looked at said that they had support from an external source. And then in terms of training, this is something we also looked at. Have the center providers had any ECD training or childcare training previously or currently? And only still for the home-based daycare centers, only 20% or 9 out of 45 had some form of training. So that means that they lacked the resources, but also they lacked the skills to give quality care. And so, we also found that the CHVs within these communities were motivated to support daycare center. 73 said they really would have wanted to support the daycare centers and were really motivated, but we also found that almost half of them said that they lacked the training and they lacked the materials to actually support, supervise the daycare centers. So the baseline findings, there were more, but I can't present everything in 10 minutes. But based on the baseline findings and the previous discussions with the different stakeholders, we focused on 4 areas of daycare, and that those really critically form what we call a nurturing care framework in health, in play, stimulation, protection, so we had 4 major areas: the child protection, play, learning through play. We had health, nutrition, WASH as one area, and we also were looking at business. Are they able to manage businesses? Are they competent, or are they just figuring it out, their own way? So those are the 4 focus areas that we found that had a gap in terms of skills and as well as resources. So, next, please. 1 minute, no. So, yes, next slide. Yeah, wasted some minutes. So, yeah. So, how did we implement the intervention, having put it together in a community practice kind of approach? We identified CHVs within those 2 locations, and for each CHV we allocated them about 4 to 5 or 6 centers or center providers who they mentored, and they conducted community of practice sessions. They're like informal learning from each other or peer support. There were really discussions, but of course the trained CHV had more knowledge, so he was supporting them to learn the good skills of caring for the kids within the centers. So we had a series of trainings. There were 4 modules. So we trained the CHV group, and then they go out and conduct the sessions. Then they come back and they get the second session, like that until we did the last session. This was over a period of 4 months. Yes. So we also provided materials for the CHVs and the center providers that they needed to use in the meantime. But also, in addition to, in between the modules, the CHVs went out to do individual support to the center providers. Remember, the sessions were group sessions, but before they went out to conduct another session, they made sure that they visited each center provider to find out how they were doing, whether they were doing what they were told, and what other support they needed. Next slide. Yes. So in terms of feasibility, remember this was our primary outcome. Wanted to look at feasibility and potential impact. Based on the enrollment and the fact that we enrolled the CHVs, but all of them from the 2 locations, they all managed to stay on the program, and all the centers that were enrolled completed the 4 modules, and we actually had a total of 136 individual visits, meant that this was feasible. It was acceptable to the CHVs and to the center providers, and it was also practical. It was doable. They managed to embed it within their routine work. And we also had some indicators of potential effects. We looked at the pre-intervention and post-intervention scores in terms of knowledge and practices of the center providers and the CHVs, together with the quality of the center environment we measured before and after intervention, and found significant improvements in the center provider knowledge and practice scores, as well as the quality of the environment. We didn't find significant effects in terms of the CHV scores, because from the beginning we found ceiling effect. We found that they knew quite a lot in terms of the daycare and caring for kids, so we didn't expect much difference. And our intention, our motivation for training the CHVs was to help them have the competence to train, not actually to give them information, but to train them to be trainers, yes, of the center providers. Next slide.
I think we are giving you 1 more minute.
Yeah, and this is the most important. So from our results, we feel that, it's clear that this model, which was a bit embedded in the government systems, is feasible and can actually be delivered by the CHVs. So we think that going forward, this can be something that can be integrated, fully integrated in the mainstream health system. But we also noted that the CHVs need to be motivated through the allowances that they actually should get. Currently, they're not getting that. And they also need resources, and there's also need for monitoring, cross-monitoring, and this can still be part of the integration. And we also felt that can form part of their the CHV training curriculum, how to support by the center providers could be embedded in their routine curriculum so that they can really be empowered with the knowledge and the skills of supporting these centers. And we also felt that there was need for a strong partnership with government and other stakeholders in ECD and childcare to scale up this intervention beyond the 2 locations that we worked with for greater impact. Yeah, and we also found an issue of license. A lot of them are not licensed because 1, they don't have the qualifications, and 2, they don't know about the system. So we felt that this can also be linked to the training to make it easy for them to register, and therefore registration would mean that there is, of course, quality. I think
Thank you very much. Thank you very much. Let's clap for Margaret. Yeah, thank you very much. And the presentation was as well interesting, so we were carried away as well. Let's usher in Stephen Ikonya from Kanko. Welcome, and we will be very strict on time this time.
Good afternoon. My name again is Stephen Ikonya from Kanko.
Please support us with
Thank you so much. Next slide. So I'll be presenting on the issues of barriers to nurturing care framework under the daycare settings. And you realize that Kenya has a large number of children population, but the issue of the looking at it from the domains of nurturing care framework, we are having a lot of suboptimal nutrition status among children under 5 years who are in the daycare settings, who are not able to get enough food. There's no responsive caregiving at these centers. The issue of safety and security for them is again an issue. Okay, it's becoming hard to present. Okay. And as a result of that, we decided to do some studies, basically to see from the household perspective and again from the child care facilities, the mapping, the assessments, what we could find out. The next slide. And that was the purpose of the study. Next. This was a mixed study. We used both the qualitative and quantitative approaches. We were able to obtain data through interviews of 36 mothers of children aged 0 to 4 years, supplemented again with 2 interviews with key stakeholders, or what we call the community-owned resource persons. And we had several focus group discussions with parents of children between the ages of 6 to 23 months. And again, we were able to do some mapping and assessments of 36 child care facilities, 36 daycares in 3 informal areas in Kajiado East. Next. So in terms of the key findings, I think in terms of the key findings, our thematic analysis in terms of the mothers and the stakeholders that we were able to interview, we realized that most of the mothers were from the low income settings, and therefore most of them were earning below the minimum wage of 110 USD, and they spent over 25% of their income on childcare facilities per month. In other words, they were earning between 6,000 to 7,000 Kenya shillings per month, and spending 25% of that in child care facilities. And again, there was the issue of financial instability. Therefore, they were not able to provide the minimum acceptable diet to their children. There is again an issue of limited knowledge on caregiving, raw male involvement because again of the issues of teenage pregnancies, low exclusive breastfeeding rates. And some of them had to return to work 2 months after giving birth. The issues of poor hygiene and work-related limitations, partly because their employers do not understand the child care needs. And again, because they do not understand, they are not willing to integrate that in the areas that these mothers are working in. When we did the assessment of the daycares, we realized that 81% of them were informal and they were unregistered. 90% of them lacked children records. Basically from the minimum, is this child immunized? They do not have those details. And even to the point of on whether the child reported or rather they were brought by their parent, there was no completely lack of records at the facilities. 2/3 of the centers, the caregiver to child ratio was very low, as they only had one caregiver with no or little training on ECD. 75% of them did not have play materials. 80% charged less than $1 per day and lacked access to credit. What that means is that if they are charging between 50 shillings to 150 shillings per day, how much are they able to provide in terms of nurturing care to that particular child? And lastly, most of the caregivers also felt that there was an issue of default in payment. So when a mother brings the child for a whole month, the other month they take the same child and they take the child to another daycare setting. So meaning that they default their payments to the previous daycare, affecting the business of the daycare owner to some a very good extent. The next. So in terms of recommendations, number one is the development and implementation of the Kajiado child care policy that we are developing. Number two, formulation of a multi-sectoral forum for increased accountability and advocacy for increased resources. I'm happy to say that yesterday we were coming up with TORs for the same. That is governments to offer community child care services at subsidized prices. Is that possible? Yes. In Kajiado, we have already been given one center to renovate. And I think with the support of donors, that center should be up and running, possibly before the end of the year. And it will be run by CHVs as a part of their IGA, income generating activity. That is establishment of short-term trainings for caregivers to enhance their capacity on ECD. So this, we could start with the 38 child care facilities, build their capacity on ECD and see how that impacts the children that they are taking care of. And then again, the county government working with women support groups and community health workers to either provide child care services or provide ECD or business management courses, among other skills, set at subsidized costs to enhance the competence of the caregivers. Again, is ensuring that caregivers provide children with age-appropriate play and learning resources using locally available and low-cost materials. And lastly, advocate on establishment and the integration of the daycares in the workplaces. That includes the EPZ companies and the flower farms, where most of these mothers were working from. Otherwise, thank you so much.
My name is Jeremiah Ireri, the Director in charge of Early Childhood Education at Temple County Government. So I think I'll take you through our presentation. Yeah, so on the guidance that we were given for the presentations, I think we can move on. We were supposed first of all to look at the multi-sectoral approach in terms of the things that we are doing in the counties. One of them was on good health. On good health, we are doing growth monitoring activities, deworming, vitamin A supplementation, that is with our partners in the Department of Health. Then we are working on child-friendly environment in schools through improvement of the physical facilities and also the environments that these children are in. On nutrition, we have the baby-friendly community initiatives and the maternal, infant, and child nutrition in partnership with the Department of Health. We also did we are doing our implementation of the county SYNAP, which is on the early childhood programs in the county, we are dealing with the increasing enrollment, that's access, retention, and smooth transition for children from PP1, PP2 to grade 1. Then on responsive caregiving, as one of the areas of nurturing care, we have the WASH program that we are doing partnership with the Department of Health, also the Malezi Bora program. Then we are also doing a program with the Embu University, which is optimizing parental engagement and empowerment. This is a program that we got a grant from Spencer Foundation, so we are doing that. We are training parents from the ECD centers and those who have children in ECD centers. Just a minute before we move. Then on safety and protection, we have a partner, Gradif Kenya, who is partnering with us in terms of training and sensitization on parents on child rights and care. Then in the Department of Gender and Children Services, we just finished construction of an Embu Children Rescue Center that is in the process of being operationalized. So I think in the next 2 months already we have staff that have been recruited to man the center. So we are yet to admit our first children, then that will be done. Then on the budget implications, the other issue was on financial. The next step was supposed to be on the financials that the county government has put in. We can move on. So that's the table of the figures. We have education sector. Our main component is employment of teachers. We have around 484 teachers on PNP. That's taking almost 294 million. Then we have a school milk program that we started in 2017 that has been taking us around 33 million per year. This year we don't have that budget, unfortunately, but it's because of sustainability issues. It was discussed that we do a factory for milk. So as a county government, we were supposed to put some matching fund. So we put our 30 million as a matching fund. Then we have got another 100 million from World Bank to ensure that that factory is complete so that the sustainability of the milk program for the next financial year then is done. Then instruction materials, we've done that. Infrastructure, we are doing child-friendly classes. In health, we have deworming. Immunization, which is partly for the county government and also by Gavi, so that's a shared responsibility. This year, because of the implementation of the CNAP, we started the Malezi Bora, which we are partnering with the Department of Health. Then the county rescue centers for the children, I think it's complete. The 15 million that time in 2019 was construction. Now we are doing the operationalization. So I think what remains now is animation and for the children that are vulnerable from different areas that we rescue. So that's the budget implication for the county government that we are putting in terms of child care. Now achievements would say one of them is on policy development. We did our Embu County ECCED Act in 2015 and Embu County Child Care Facilities Act 2015 that takes care of the daycare centers that were being talked about here. Then we have developed the county CNAP, that is County Nutrition Action Plan 2021-2026, which we are in the process of implementing with the other departments. On access and equity, we have been able to move our net enrollment rate from 47% in 2014 to the current 71% in 2021. We are still working on that. We have also been able to establish new feeder ECD centers, especially in areas where children who used to walk more than 2 kilometers to school or where we have concentration of households. Personnel, the county has employed a number of teachers on a permanent basis. Then the other achievement is on, let's move. On curriculum, we are implementing the CBC just like any other of the ECD centers in the country. We are also on co-curriculum. 2019, when we had the last music festivals, two of our ECD centers were champions at the national festivals in Nakuru, and we were able to entertain the president in Nakuru State House. Then on quality, we are doing model ECD centers that we've done. On health, we have the school milk program in all public centers, then the WASH programs. Then the other issue was on challenges that you're facing. Of course, one of them is understaffing, because the new curriculum has established 2 classes at ECD level. So, and we had 1 teacher initially per school, so we have to get a second one. Then lack of adequate curriculum support materials, again, as much as we had provided some before CBC, then now we have to do new ones for the CBC curriculum. Then we will still have low access of ECD, especially in the semi-arid areas of Embu County. You realize our net enrollment rate is at 71, so we still have around 29% of the children that are not accessing our ECD centers. Then lack of capitation grant. Most of the other programs, primary, secondary, vocational, are grants, but for the ECD centers, we still don't have grant for these children. So some schools still have to charge some levies for employment of an extra teacher, cook, and so on. Then the other, let's move on. The priority areas going forward, one of them is improving on infrastructure, especially sanitation facilities. Almost 80% of our ECD centers share facilities with the bigger lower primary school children.
Mother is able to produce milk to the extent the production of milk is partly also determined by the emotional and the physical qualities of these mothers. So we realize that most of these disabilities could be linked to the quality. And maybe as we had the earlier discussions today, this is an area that probably we should seek to invest in, and probably do another study to see are the child care facilities really contributing to, and why. And I think the study for Kajiado showcases why. With regards to the second question for Kajiado County, the training center, I think one of the proposition, when we were developing the child care policy, we also agreed that once we are done with the child care policy, which is inclusive and integrated, actually it's one of the most unique, it will be a very unique policy because it captures the 5 domains of nurturing care. And in terms of inclusivity, again, it seeks to address the issues of disability very well. And we agreed that once we are done, we will be coming up with a caregivers curriculum. I think also in Kenya we do not have one, and so it will be very interesting to see from the multi-sectoral forum the kind of the curriculum we will come up with, and that will form the basis for what we talked about, a training center for the caregivers on nurturing care framework. Otherwise, thank you so much for listening.
Thank you very much for the panelists. My apologies, I'm not going to take another round of questions. As you see, we are running very hard on time. Let's clap for our panelists, our presenters, as they move back to their seats. Thank you very much. Embu County, thank you very much. Kajiado, through Kanko, and thank you very much, Daktari. Thank you very much. As we can see, there are a number of things coming up, and I hope we are taking note, the presenters, on areas that we need to go and add or improve on. I wish to welcome the caregivers from Kidogo. I also wish to welcome the Action Foundation and Uthabiti to come up front for the next session. This session will take 10 minutes, and then we'll have another round of 5 minutes of questions. Same structure too. Thank you very much. Thank you very much. So this next session, we are going to request that you give them microphones, because this is like a discussion that is guided by questions. I have a few questions here. The first question is, what are the challenges in childcare workspace, and how have they been, or can they be mitigated? What are the challenges in childcare work? How have they been, or can they be mitigated? What are the challenges? Thank you very much. As you speak, please ensure you introduce yourself and where you come from before you respond to the question. These are general questions for the panelists here, and any of you can respond.
Hi, I'm Irene. Some challenges we faced in our centers. Some small spaces in our centers. We have home-based, school-based, and center-based. So home-based, we face challenges of space, playing for that children's, 2, payment program, 3, lack of license, 4, lack of nutrition problem. Some parents, they don't have the knowledge, the impact to how to put balanced diet for that children. So we face that problems. 3, poor means of communication, abandoning of children's financial instabilities. You found some our centers most we have in our houses. So you found caretakers, harassments, there lack of the mattresses for that two children to sleep, lack of foods. Others they don't come with food, they come without food, so you have to give them your food. Lack of relationship with parents, lack of relationship between parents and caregivers. Some parents are rude. When we come to the issues of the children, we found others, they come with the clothes they wear today, they come with it tomorrow. They have not bathed. So we face many challenges to discuss with that parent and come to be with us to provide that sound for a better future, now to be in good nutrition and balanced diets.
Thank you very much. Thank you very much. That is a powerful one. Could we have the next person responding to the same question?
Yeah.
The next caregiver. Okay, go ahead.
Hello. Thank you so much. My name is Dennis Kangu. I'm a field coordinator at Kidogo, leading the social franchising program where we work with caregivers to ensure they provide quality and affordable childcare in the communities that they live in. So just like one of the caregivers have mentioned, we have the issue of licensing in the centers. So you find that the issue of ECCED is devolved, and in acquisition of licenses, it's the procedures that you find in Nairobi is totally different in Kajiado. And by the fact that we operate in more than 7 counties, it's so hard to know which sector or which department within the county government are you supposed to go to find the licenses. And then the other issue majorly you find is that harassment. You'll find the public health officer will come in, they want to see, where are your licenses or what are you using? The food handling, they'll come in, because you'll find some of these centers, they do cooking at their centers, or parents bring food. So when a public officer comes in or a food handling officer comes in and tries to ask, where is your handling certificate, food handling certificate? Or sometimes you'll find that the kanjos are coming in and they want to understand, do you have the licenses to operate? So I think one of it is when we identify these mamas or the caregivers that are running these businesses, especially at that first contact stage, you find most of them, they don't have that basic training on how to take care of their children. Just like as she said, majority of them do it at their home setting or at their center. This is where they rent and they just start to do the business as passion. And that's one of the challenges that majority of the caregivers that are in our program do face. Yeah.
Thank you very much. Thank you very much. Closely linked to that, please could you just share with us the challenges that you caregivers faced, especially with during the COVID-19 pandemic? Maybe just one person, and then we go to the next question.
Allow me to take that first. My name is Sofina Merino from Authority Africa, and I want to welcome all of you here. But also I work with the workforce development team. So the views I'll be representing here are for the women we've been working with. So Carolina, just to answer your question, is that especially during the COVID times, and I'd like to phrase this as the challenge of, my colleague Dennis has tackled registration, but also identification, enumeration and networking. What this means is we actually have had some of the county governments and the organizations giving items such as tanks for hand washing facilities, offering soap, but they were not able to reach everyone because these women have not been well enumerated and have not been well identified. So I think that is really a great challenge because we have realized, we've been able to engage a focused group, but every time you go back to the community, they're able to share with you, there's a woman somewhere around the corner who does the same job and would wish to access the services. So I think that is one very great challenge that we have. And just to move on to the next point, slightly on the challenges, I feel that there's a great challenge in, we call it training. I've had most of the countries talk about it as training, but I think it's opportunities for learning and capacity building. From our interactions once more, you realize that these women, you go to them and tell them, probably we have a training, they don't see the need. The truth is, this woman she knows everything about childcare. Why? She's raised a child, she's raised her sister's children, and she can get information from her mother and her grandmother. Not realizing there is a need for a holistic understanding of what childcare entails. We are talking about the nurturing care framework. So that is a great challenge, and probably as a solution, I think we need a change in our mindset shifts of what childcare entails. Because even the parents themselves, you tell them, I need, say, your nanny, we call them house girls in Kenya, I need your nanny to be able probably to do training. They'll tell you, no, she takes care of my child well, she knows everything, and I can give her the instructions. So I think it's very important for us to have that mindset shift in the sector. But most importantly, now that we are all here, we have the challenge of synergy. We have the challenge of working together. From our presentation since morning, we have realized that different stakeholders, and I know for sure, we are doing amazing, amazing work. But what is it that we can be able to offer each other? And I really wanted to give this point across from a very practical point of view. So over lunchtime, I was fortunate enough to sit at a table where we had the county of Tharaka Nithi, and I had a lady from called Aruna from Greens Recycling. And Tharaka Nithi were just sharing with us the challenges of their creche. And they're saying, for us, it's made of, so it's very beautiful and it has glass, but because they're children and the women, and it's near the, where there's traffic, all the glasses have been able to break. And just from that conversation, we had Arun actually mention, what, we do recycling, and she showed us an actual structure built from recycled material. And for me the challenge was, what if all of us knew about Aruna and other partners such as, Kidogo and Tiny Totos who are doing amazing work in the sector? I believe just sharing that information, that is a solution to the challenge itself. Thank you.
Thank you very much, Sophina.
Do you want?
Go ahead.
Same question? Okay. So my name is Tejpreet Gaur. I am the managing director at Strong Start, which is an ECCED company where we work on ECCED solutions through caregivers. So so the question was, what are some of the challenges that caregivers face during COVID-19? And our organization's a little bit different, where we work with mainly middle to upper income households, but the caregivers come from lower income communities, and that's where we work on skill building, professionalism, etc. And what we found was during COVID-19, a lot of the caregivers, one was that a lot of people lost work and jobs, so they were completely out of work and were finding a hard time actually making ends meet in their homes. Households were really tightened, budgets were very tightened, so often, not only, those who did survive the job cuts were, facing salary cuts at home, or they were taking on double workloads, because if there was a domestic worker, a housekeeper and a caregiver in one home, all of a sudden they were actually faced with taking on both jobs. Also, because schools were shut down, what we were finding is that all of the children were home. So usually caregivers were taking care of maybe one child that was in the preschool age or ECD age, but however, because schools were closed, all children were home, plus employers were also working from home, so there was just like doubled workloads, etc. What we also knew that was because of the fear of COVID, a lot of caregivers were also not given the freedom to go home during the lockdown. So they were spending 24/7 at their employer's home without the ability to go home. So there was like large cases of isolation, a lot of mental health issues, and just where they had an open desire to go home, but had a lot because of lack of ability to, or maybe fear of losing their job as well. They were not raising that with their employers. I can get into solutions, but I know that there's a limited of time, so maybe I'll pause here, and perhaps that's coming up in the next round of questions.
Yes, thank you very much. And my last and next question is, how can we then organize differently to improve to improve outcomes in childcare spaces? So kind of like, what are some of the solutions that we can have to mitigate these issues? I know issues are a lot, but we have just mentioned a bit. And how can we work differently? How can we organize differently?
Yeah, so I'll go first. I think one of the major steps that we've taken as an organization with the lead of Martin, we've started to form some partnership, and one of the major success that we did, especially last year, was partnering with county government, and the first one was in Kisumu, and we are also have some other partnership in Mombasa and Nakuru County, just to ensure that each and every person is on board with the issue of early childhood care. And in that, it basically means we need to start to advocate for it more. We need to make sure that these are a priority area that we need to focus on to ensure that our children get a strong start in life. And for me, partnership and advocacy, and of course the policy part of it, will ensure that we get that right step to move forward in this sector.
Thank you very much. Could we hear from the team members on the farthest right?
Good evening. I'm Victoria. I'm a mother to a 7-year-old child living with cerebral palsy. We face so much challenges. Challenges like schools. You find that if you take your child to school, the teacher will ask you, what can he or she do? Can he eat by himself? Can he put on clothes? It's very difficult to answer such questions because a cerebral palsy child has a delayed milestone, so they don't do things like the other children. You find them, they grow slower, not like the other normal children. So getting schools are very difficult. Skilled personnel, teachers who are well trained, it is very difficult to, the government should invest in training teachers for special kids so that we may get good schools for them, because we know with time they will improve and have a brighter future. And when they need therapy sessions, you find the therapy is very expensive. So we would urge the government to at least let us use the NHIF instead of cash. Maybe you want to take him there, you don't have that cash, but you have NHIF. So those are so many challenges we face. And in nutrition, so they select food. They don't eat random food. Their food are, you give them balanced diet, and you find that other caregivers, some of the caregivers that cannot afford that, the balanced diet. Yeah. So those are some of the challenges we face as caregivers of the children living with disability.
Thank you very much. You have said the challenges and how you think it can be done differently. The government is in this house in all their levels. They have had it. Thank you.
Good evening, everyone. My name is Caroline.
I'm a mother of 3 children. Allow me to speak in Kiswahili. Mimi ni mzazi, mtoto wangu anaitwa Emmanuel. Challenges yenye tunapitia kama wazazi, unapata ukienda shule, kama mtoto wangu ako na 8 years, ukienda shule unaambiwa anatembea. Na unajua mtoto wa cerebral palsy, kutembea kwake inachukua muda, ni kama long distance, unakuwa na hope, journey of hope tu. Sio mtoto mwenye atatembea haraka. Na sasa unapata kama uko single parent kama mimi sasa, unataka uende ufanye biashara na mtoto tena ndio huyu uko na yeye. Sasa unapata kama kazi ni ngumu, lakini unajikaza. Mpaka sometimes unapata kichwa inauma tu, unapata uko stressed kabisa. Juu ukienda shule wanasema hajatembea. Tunachukua watoto wenye wako 14 years, wale wanaweza tembea. Sasa unapata tu unarudi tena na mtoto kwa nyumba. Ukimfungia pia, serikali inasema ifai mfungie mtoto kwa nyumba. Unapata sasa kazi inakuwa ngumu kwako. Sasa hapo tu ndio mungeangalia upande ya shule kama wanaweza access tu watoto wote tu. Wasiangalie age, tuseme kama kuna 6 years hapo, wa accept tu hata kama anatembea ama tembei, anaongea ama ongei, juu every child ako na right ya kwenda shule. Alafu upande mwingine ni kama hizo maneno za watoto wetu wengine wanakuanga na conversions, dawa inakuwa expensive, na ukiwa single mother unapata uko mara chakula, mara rent, mara upande ya nini ya hizo madawa unapata iko expensive. Sasa unapata unaumia. Sasa hapo pia mungeangalia kama NHIF inaweza cover hiyo maneno ya madawa. Alafu nutrition na watoto wenye wanani kama chakula yenye kwa mash, unapata saa nyingine wazazi wengi hawana hiyo ni ya kumash chakula. Ni lazima chakula yao iwe soft ndio wanaweza ku. Sasa hata kama ni shule wanafaa wapate hizo vifadhi na hizo vitu za kusoma na wanaweza hitaji. Ni hayo tu kwa saa hii.
Thank you very much for the beautiful presentations. I wish to end this here, but before I end, I would like to give a chance, an opportunity to 2 members of this room to ask questions to these beautiful panelists over here. Any question? Going once?
Sorry, please. Sorry, please.
Thank you. I don't have a question, I just really have a comment. Thank you, panel, that was great. The insights are very, very important. I want to speak about the need to collaborate, the multi-sectoral, the partnerships. I think that this cannot be overemphasized, and I would just like us to move from rhetoric to action on this and really do it in as practical a way as possible and as fast as possible. Because in the meantime, our children are suffering out there, and individually we have 1 or 2 solutions. Together we can achieve much, much more. Thanks.
Thank you very much. I'm Frederick Olwach, Director Health Kisumu.
Thank you very much for the team. I think the presentation there really reflect what is on the ground. I think there were some issues that were raised. If you look at issues of public health coming in, and now if you look at the weather regulations of the ECDs and the daycares, I think we need to have this in record, because most of it, you look at the ECD policy, should, as we are reviewing it, should now take into consideration the issue of regulations of these ECD centers, whether we want to know the level of qualification, and then the multi-sectoral. The role of the public health there should not be that they are coming to close down the daycare, but now to come and help you see that the children who are there are already vaccinated up to date. The food that they are eating are clean, and there's proper hygiene. There is good sanitation. There are friendly, baby-friendly toilets and services, and that they can also help in assessing disability at that level. So the work here of the public health is not coercive, but here to come and help you comply. And at the same time, they are looking into the safety and security of the child. How safe are they there? Then, of course, there are issues of nutrition, immunization, all these ones we need to look at. But we are also realizing that those who are running these daycares, you know, most of them do not have a training or background, so that can help them even detect a disability. So this is why we want to see the role of health here is to connect the daycare centers to the nearby health facilities through the public health officers or nutrition officers. Then there is also the issue of now the services, the centers, the disability centers for these children, the identification of the children, the screening services for the children. And there's this role of now the Department of Health again in disability assessment and registration for these children. So we have to work together, multi-sectoral, and I believe that health has a lot to do. This issue of exclusive breastfeeding, which is 6 months. And if you look at now the policies on even maternity leave is 3 months. Then what happened after 3 months? We still need the babies to get exclusive breastfeeding, breast milk, for the other 3 months. So what are we doing? We are supposed to do expressions. How do we are leaving this expressed milk to the people who are taking care of our children? Maybe they're not trained. What about the hygienic situation of this milk we are leaving? So this now exposes the child again to other diarrheal diseases. You are having increased cases of diarrhea, you are having cases of whether rotavirus or what. So we really need to take care of this, and the bill, the policy now gives us now ability to sort where we are not fixed. And as Kisumu County, we are working on the ECD bill, which is taking into consideration all these children from 0 and even 3 years, which is, there is a missing link there. And now on the regulation of the daycares, who is supposed to open them, the qualification, then now the role of the different sectors within the county and even partners and stakeholders in managing these ECD centers and daycare. Asante, thank you.
Thank you very much. I think those were more of comments and not questions. But in the room, we do realize that there is still a missing link and that some action needs to be done. I want to thank you very much, our panelists. I want to thank you very much, our caregivers, who came to share their experiences and who came to really trigger some action. We believe and hope that some action has been triggered and some discussions are going to start happening. Asanteni sana as we clap for them. I think we are done with our session. I wish to thank you very much for the time that we've had. And it has taken a bit long, and I really appreciate your patience. I think we are still 100% in the room, but the discussions, you want to agree with me, that were very, 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 very touching, very, very educative, and very, very important to us as we're seated in this room. As we carry on with the conversations, I wish to continue welcoming you to come back tomorrow so that we hear more and more of the discussion, conversations, and at the end of it all, I think we are going to head somewhere. Asanteni sana, thank you very much, and I still appreciate the presence of the First Ladies in the house. Thank you very much.